Where's the third? Let's go ahead and get started, buddy. Go ahead and introduce everybody. Make sure we have a forum. Martin, start over here. Yeah, we just have a which yes. Yes. Thank you, Rona. Let's go.
They know. Police Chief Health.
Mark Christiani, Police Chief.
Chris Gleisler, Police Chief.
Hi, I'm Doug Harris. I'm behalf of Sheriff Burlock. Holly Williams, County Commissioner. Lynette Craverson, President of City Council.
Jake Marcus on behalf of Undersheriff Teller County.
Arch Cone, Commander, Colorado Springs PD. Stein Brodsky, ER position, Common Spirit, non-voting member.
Dr. Ellen Russell Holsley, County Coroner.
David Linover, County, City. Council.
But I didn't tell my health about it. It's fine.
Oh. Just for the day, not forever.
Share, say it like it. Steve Johnson, Coast Springs Park Board. Are you sure you're Colorado Springs? I am. Awesome.
Oh, great, Mayor El Paso County Commissioner, 100% sure of that. Yes.
Eric Stokes, Teller County Commissioner and Vice Chair of the Council. Mike Allen, DA and Chair. Do we have four? Okay. Let's go back to Troyer. Consider yourself just quickly.
Bruce Airbow, member of full circle.
Keep there for one very full circle.
Sam Wilson, full circle. Thanks, yes, sir. Colorado Program Director.
Managing staffer. Declan Thompson, Colorado Springs Full Circle.
Great, thank you.
Judy Bryant, El Paso County staff.
Kenny Hodges, Nassau County Attorney, which advises council.
Great, thank you. Let's start all the way in the back.
Maria Cortez with Quebec Rec Department.
Thanks for being here.
I'm welcome to your Rec Department.
Corey Miller, great to have your contact here. Thank you.
Sherry Traver. Colorado River Connection.
Thank you.
Leonie Murphy,
Todd Jones, the Phoenix.
Allison Dodge, one chance to grow up. Diane Carlson, one chance to grow up.
Great, thank you. Well, let's go in this front right now.
Rachel Rose, possibly contributing. Work with Alva, the conflict like for council DM, the spirit special post agreement. Becca Barnhart, public health analyst for the CDC Foundation. Kathy Reyes, Drain Initiative. Kelly Hurtado, Check Justice.
Thank you.
Beth Rolfson, CEO of Palmer Pikes Peak.
Thanks.
Matt Revere, affected parent and non-voting member.
Eric Olson, next together.
And then back here.
Tim Otley, Teller County DHS, non-voting.
So the other thing that we're able to help with Maria's help is that when there is a loss, we're able to provide support at maybe the memorial service or directly following after. We know that this is a time when families and young people are looking for help with self-regulation. It's often a time when folks reach to the wrong coping mechanism. So putting resources right at their fingertips is really helpful. And we have provided a model of kind of post-vention response that gets them the resources they need immediately, and then we stay with them for the duration, kind of as long as needed. But we attend memorial services of students, and this year it was sad because one of the schools was twice for teamwork first attending. We do school faculty training, so we were able to partner with many of our school districts to do QPR trainings with them during their professional development days, which professional development days are scary because if you ever look on social media, teachers don't love professional development days. And so when you're going in to do those presentations, it can be a little intimidating. We meet with the school faculty. We do youth service requests. So at every youth event that we do, Maria is there collecting service requests, and she's able to meet with those students right away and help them get the help that they need. And so our goal really is to help them build a communication bridge with their trusted adult at home and access the community resources that they need. So if they come to Maria and they say, I'm talking to you because I'm really nervous to talk to my parents, then one of our goals is like, let's figure that out. As we know that you're going to need that parent, like they're actually like your main source of access to help. And so let's figure that out. So we end up doing these family meetings, and those are often when a youth is identified to be struggling, and usually engaging in a lot of behaviors that would some maybe just some conflict between them and their parents at home. And we just help facilitate a conversation and identify, you know, what's making it hard to communicate. And the way that we open that meeting is like we have everyone in the room, the parents and the young person, write like, what do you wish for your, and we have the parents are like, what do you wish for your kids' life? And what's really stunning about this, because every single time the lists align, they want the same thing. And really, when they're able to see that, it just really creates a nice place for communication. And we're also able to help them access community services so they don't feel like it's all on them to do that. And then we do check-ins along the way. Another common time when we do this is when a youth has been hospitalized. So upon returning back to the community, we help the family create a plan to create safety in the community and to partner with the school, so that everybody knows how to best support this young person in every environment that they are in. Next slide, please. For our youth outreach, we do resource tables everywhere. And we did teen community nights at Hillside Community Center this past year. We did all of the What's on Your Minds, the Youth Documentary Academy, we partner with them. And that's a big one because the event is called a film festival and everyone wants to go to a film festival. And so the films are all made by local youth, and what our role is to facilitate a conversation. Like what came up for you as you watched this film, and helping you know, young people again either have conversations with themselves or some intergenerational conversations, because we know that communication is really the key, and helping folks have these conversations about some of these hard topics can be exactly needed to make sure that everyone's staying with it, kind of a safe path. We do a youth grief group. This year we did specifically at schools that were impacted by losses, and those ended up being really impactful because many of the young people who ended up being impacted by losses were engaging in some really high risk behaviors, and their friends were able to come forward during those bereavement meetings and say like, we're scared and we need help. And so it just created another portal for them to access and be able to talk out loud about the help that they needed. And then next one. Perfect. Do you have questions for us?
Any questions for our presenter?
Yes.
So obviously we're the opioid council, and what you're doing is amazing. And I'm 100% support never mention drugs.
So every time that I guess I need to, you know, when I say high risk behaviors or unsafe behaviors, we're talking about self-harm behaviors that include substance abuse and alcohol abuse. And so those are often the risk factors that are most visible for folks when they come to access our services. And they are the coolest, like maladaptive coping tool for young people to access. And that's just like an age thing. And so it's easier for me to say like, let's get high or drunk than it is to say like, I'm sad or anxious or grieving. And so when we know that they are having those, they're in situations where those negative feelings are coming and that they're going to be looking for self-regulation. That's really where we're trying to either proactively talk to young people about before it gets to that point, or when you know, what are the other strategies, and having young people talk to other young people about like, here are some alternative strategies that help me. And in fact, our young people made these booklets to write examples of that just show like, here are some of the strategies that I'm using to help myself self-work.
And also during our What's on Your Mind presentation, we do a poll, and one of the questions is, have you used food, drugs, or alcohol to cope with a difficult situation? And more often than not, the answer is yes, compared to the no's.
So that really helps us to understand that the audience that we're presenting in front of, like, this is relevant topics, that they need replacement behaviors for engaging in substance use. And that's kind of our goal of giving them replacement behaviors and also giving them help, because saying that you'd like to have a replacement behavior and actually creating them are two different things, and you really do need support in creating those replacement.
I have a question, if that's okay. I know you talked about that there's a lot of different examples of what you talk about, like healthy relationships, suicide prevention. I'm specifically talking about, and I'm sorry, it was early in your presentation, it was like the audience is parents, and they get to ask young people, like, how should I do this? How should I talk to my kids about that? Do they end up talking a lot about how to approach young people around substance use? Because we hear that all the time, how those conversations are, they're daunting, we don't know how to go about it. We don't know what to say. We don't want to be fear-based, but we want to be open, but there's still, like you said, consequences to action. So does that come up a lot in those conversations?
It comes up a lot in those conversations, and then also in our film festival conversations, because some of the films touch on youth substance abuse. And so, you know, it's very common for adults to feel uncomfortable. It's almost like a role reversal, right? Like, I think it might be happening, but I'm afraid to talk about it. I'm afraid to come to you. And, you know, and so our young people are so well versed in talking about, like, speak back what you're seeing and come from a place of care and compassion. And they're so kind when they tell the adults that. I feel like some of the adults are like revved up to go have this conversation when they get home. And I often wonder, like,
Time for one final question, anybody, please?
Yeah, you included advocacy, and I was just curious, you tell us a little bit more about that. What was specifically advocacy, advocating for something specific, and how do you feel like that fits into programming?
their overall role in advocacy is really speaking. We try and help them get to the table at their schools, at local coalition meetings, taking them to, you know, the mental health advocacy day, and letting them speak about the things that they think are impacting youth based on, you know, what they believe they're seeing that's relevant at their schools and in their communities. And, you know, we help them, they go through training about, you know, how to write a letter to the editor. They go through, they end up getting interviewed quite a bit. And so they go through media training on how do I best get my points across when I'm speaking to media. And so they're just given opportunities to advocate in all those different spaces. So that's your question.
Partially, the photo that you had was specifically at the Capitol, so I was curious.
Oh, on that day, so
Is too many people, were you advocating for something specific, or?
they went up on Mental Health Advocacy Day, and the House bills that were up there were the two reference right there for behavioral health crisis response and behavioral health insurance coverage. And so, for example, for the preparation of that day, they're given the bills to review, and they decide kind of what their stance is on it, and they prepare talking points to speak to the different legislators about what questions they have or what they may or may not want to advocate for. And, you know, they end up being on different sides of the issue sometimes, and they also end up asking a lot of really good questions. But it's really good experience for them to kind of get to see where our laws are made and what that looks like.
Thank you very much for your presentation. We can have it just with wires and things like that. And I will make sure the council gets this presentation in minutes. We're moving into the agenda phase where we are going to review the kids. In order to maybe make it somewhat easier for us to move it together, these 5 pages, so I gave you copies in front of you. Basically summaries, 1 page per document on that of each of the applicants that are in front of you. You have your materials already, you read it. I just summarized it. I made some things to consider on there for you. Right now, we're gonna have the first presenter. They are ranked in order of present score. So the youth prevention, the top score original score was the circle program. They're a known entity. At this time, I have the full circle program in front of you. As a reminder, if you have the materials, they are just going to take the questions. They're going to speak 2 minutes as a summary and then take Q&A. So that I'll invite them to the stage. Just come back to the video. Fine, that's the scale that we have. You have in front of you as well. It's going to be a 100-point scale, but the way it ends, it's 500-point scale because how it's weighted. So if they hit from 1 to 5, just for guide, not at all. So very effective. And then you score it, and it'd be like 3 or 5. That section would be 5 times 30, 150. So at the end, your total would be up to 500 based on the weight. So hopefully that's not too complicated. That's the score.
I was told there was no map.
So, right now we have a full circle program, a few background slides I just put together. You have in front of you as well. So the main objective of the program listed in front of you. Lists those that you pulled out from reading the applications. These are listed in front of you as well. And then the agent document, which is right in front of you as a guide. I will say on a budget, this happened a few times. So one of our process improvements on the website is that at times they put one thing on the application and another thing in the budget. And so we've got to force it so that it has to be accurate. It's a small number here, have a lot of applications in my sense. But on this one, it's 2013, 500 on the application, 13 minus the 500 on the actual budget.
It's just clarifying, we're not scoring, scoring is for our own personal use. It's not something we're turning in.
Correct. I think you collect all this afterwards. It's just a you that went a little deeper into the application pros that go on to feel comfortable with that.
So we're not, like, last time it was a big scoring process.
No, we're not trying to avoid the 12-hour meeting. We might have that, so like the car taking away. That's for your use only. And then you have a conversation using as a guide or not. We also talked about this guy not being swayed to make a decision. There's other factors. That's why the Q&A great. Any other questions before I? So again, you've seen these documents before. You have and their full application form. This is almost a cheat sheet. It's a short summary of what you have already. I hope you find helpful. If you don't find helpful, have a great next meeting. With that as a backdrop, take it away. And you have 2 minutes on your slides, and then also time for Q&A. Right? Already have one slide, which is just going to provide us.
Perfect. Well, first off, my name is Bill Stenser. I'm the state director of Pulse program here in Colorado. And we have 2 minutes. So first things first, raise your hand real quick if you already have heard about the circle. Okay, we've been doing a lot of talking. So everybody has at least heard of it. And within the 2 minutes, the thing that I mainly want to hit on is this is the Opioid Abatement Council. Full Circle is a youth at risk program. We serve adolescents and young people with a variety of issues. However, how are we going to abate opioids? I think is kind of the key point. And one of the things I've been discussing in the community across the entirety of the Front Range is that the way that we look at substance use disorder and mental health is a little bit the opposite of the way we look at everything else. We wait until something becomes stage 3 to actually address it. Right? A young person doesn't have a drug and alcohol problem until they're using opiates. Studies would show that oftentimes they start at a younger age, starting with high concentrated THC, negative behaviors, issues with their family, school, things of that nature. Our goal is to catch them at that point before they ever even reach that. Now, that doesn't mean that we don't serve adolescents and young people that struggle with opioid use, right? We do. We have plenty of them in the support group. But our aim is to catch them 13, 14, 15 before they get to that point and provide them with resources and tools so they never even have to go down that. Because although we are in an opioid crisis, what we see having the most lasting and largest impact is the family. It affects the entire family. And from our perspective, we're in a little bit more of a family crisis than we are in an opioid crisis. The level of families that are being torn apart on a day-to-day basis with no resources or resources that only address one aspect of the problem. It's pretty daunting. And so our hope here in Colorado Springs is to be that resource. We're trying to be the glue between the cracks to connect clinicians, treatment, therapy, schools, everything across the board. This is the data classically. I know this. I run a nonprofit. Nonprofits are ran by highly passionate people that don't understand business and don't like taking data. Love it. But our goal is to be able to track the data because there is nowhere else that we can survey an honest population of young people. I remember taking surveys in high school. I was high when I took them. I wrote, no, I've never used drugs and alcohol, right? I wasn't done. Are young people on? So baseline, 83% of the young people coming in the program are using drugs and alcohol. The reason that's not 100% is because we don't deal just with substance use. We deal with substance use, non-suicidal self-injury, promiscuity, struggles with pornography, and really behavioral issues. Predominantly it's substance use, but that's why it's not 100%, as well as we have young people coming out of long-term residential treatment, things like that. We also use the GAIN short screener tool, which is a quality of life survey that's evidence-based to survey adolescents and young people on their quality of life. So 94% of young people had thoughts of suicide in our communities, 100% had sleep disturbances, 94% had anxiety symptoms, and 100% were experiencing depression symptoms when surveyed. What I'll also say about young people is what's cool in 2025 is to have anxiety, depression, suicidal thoughts. So that might be why those numbers are so high. Our young people, after 90 days in the program, have only 8% are experiencing thoughts of suicide, 47% are experiencing disturbances with sleep. Some of that is just because of TikTok. 33% are experiencing issues with anxiety, which is somewhat just being a teenager. 25% are struggling with depression because they've had things happen in their life. And in closing, 1 minute. In closing, I know you guys have heard about Full Circle. Adolescents and young people are obviously being impacted by this. I think we can all agree. But the thing I think that sets us apart is we deal with the whole family. We have separate parent support group meetings that are parents talking to parents in the same that as the young people talking to young people. And our job is to keep the gate and connect the dots. I'm not a parent. He's not a parent. Our staff is not parents. We have been young people with substance use issues that are now people in recovery. And our goal is to speak both languages and connect people in the community with other people in the community. So we didn't reinvent the wheel. We're just doing what has always worked. And so our hope is once this happens, ideally, once this happens, we'll get a physical location here in Colorado Springs for our guys here in Colorado Springs to be able to be advocates and do some outreach here to the other young people. No one listens to 16-year-olds like other 16-year-olds. It's just the truth. And their voice will be 10 times more powerful than ours. So
That's all I got that. I think this is the process of treatment after the treatment. Last time we thought there wasn't enough data. So we asked each group to come up with a data slide. So some of this is new, what you see in your presentation. The budget, once again, is not. That's what was in the document you previously had. Just to take a step back, I want to highlight that this is the funding that is asked for all the SOWs in this cycle. And if we want to fund each of these groups, we'd be $1 million short in funding. We don't plan to fund all the groups anyway, so just highlighting what's available. That was another request for this group. So Full Circle program, they asked for $213,500. At this point, we'll open any questions. Sorry, questions don't.
Yeah, thank you. Love Full Circle, love what you're doing. Very, very excited that you're coming and have already started in Colorado Springs. My only question is, having come from Denver where you're now more firmly established and doing more up there, what does long-term sustainability look like for you guys? Because obviously we have a finite amount of funds in the coming years, but what does that look like for your organization in the future?
So the goal is diversify funding, right? Just a buzzword answer, but that's the goal, to diversify the funding between private donations, fundraising efforts, as well as different grants. So we've actually hired on a separate grant writer for Colorado State that's constantly pursuing funding. We've already received funding here from the Colorado Springs Health Foundation and are looking to just continue to get tied in here in the community. Our goal, so that's like that is going for any of you that know. He wants to do a golf tournament here in Colorado Springs, things that draw a lot of people, have some of the young people play golf with some people, think it'd be a good time. I don't know if Bruce is very good at golf, but Bruce is gonna play. And really, as we continue to grow and expand, what we're actually working on a national level is a capital campaign. Full Circle itself has been built mid-flight. We took the plane off, no one expected it to get this big, and so we're putting the wings on as we're saying. But ideally, a capital campaign on a national level will help fill in the gaps. if we run into that. And then on the flip side, we now have me overseeing state, Declan overseeing at a local level. Sam is helping out as well with the fundraising efforts. The split combined effort of a grant writer and fundraiser here in Colorado should be able to cover that, as well as the program grows. We'll be creating a fundraising committee through the parent support group of people that are local to Colorado Springs that understand the community in a way that we just want. So that's our goal.
Thank you.
Of course.
Any other questions? Please.
Are you currently using HMIS data? We've talked about data. Data is everything.
Yes.
And so in our community, we're really pushing the HMIS data programs.
We are not. I'm actually not familiar. I would love to hear about it. It's one of the things.
It's Colorado based, so it's you could have because Denver's got it also.
So we ended up, what we're using to track data is a survey that was come up with in combination with the Behavioral Health Association. And we actually created an app with the young people download on their phone. They love taking surveys. They're looking at me right now. But an app that gives them a push notification. They sit down with the staff and take the survey there on their phone. We've been using that survey, Behavioral Health Association, as well as the Game Shorts. But our hope is to add in more data points and just key indicators so that we can prove basically its effectiveness. There's not a lot when it comes to how to track adolescent quality and well-being or how to measure success, with the exception of the numbers that we showed up here. But I would love to.
Yeah, it's mostly focused around homelessness. I mean, that is what it is. And trying to build a database of homeless population, be more accurate with data around that. But I would strongly encourage you to really kind of look at that because it's a program that a lot of organizations are embracing. And we're actually reaching out to the jail. We're having a presentation with the county jail week, aren't we? For that, and looking at that, because data is everything. And if you're going to, from us, we're really like, are we seeing outcomes?
Yes.
Okay.
And, I understand from your perspective on some levels of events, we don't have a forefront. Here's exactly what we did and how we served the community. It would be ridiculous to ask that. So we will, and I'll look into that and see if there's a way that we can basically intertwine that what we're already doing as far as data management.
And have you started working with partner organizations? I mean,
We've been hunting.
okay.
Declan and Tommy have been driving around talking to different people in the community. And one of the things that I actually wanted to address today is these guys are going to be hanging out, trying to just have some conversations with you all to be able to schedule some in-person appointments so that we can go, how can we develop community partners here?
So I'll give you a name and you can contact me or I can help you. Amy Cox for the city is probably a primary contact that you reach out to.
Thank you.
And just Commissioner, whoever we decide, I think part of the contract negotiations can be those hard metrics. Talk about some of the metrics they measure are hard for us to get apples to apples, so we have a dashboard report to the state. It's hard to say, so it's part of contract negotiations, and we have an opportunity to get specific data requirements.
Yeah, whatever data requirements you guys come up with, we would be able to implement them. That's why we created the apps. So that way, whatever either grants or ROACs want us to put into it, we could simply add those numbers in or that data the way we're trying to translate directly to the other. So,
Other questions?
Melissa, who did you bring with you? So this is Bruce and Cadence. They're the best. They're two of the leaders in the support group. They've been showing up to every single meeting, every single function, reaching out to a lot of the newcomers and have been involved since day one. Not share too much. Just don't mind you.
Yeah, we need names or specific. I'm just curious, how did the program help you if you were a participant in this? What did it do?
It saved my life. Like short and simple, it saved my life. When I first joined the program, I was actually in this building, receiving charges, and the program helped me move through all of that. Charges that right now no longer have to develop this. And I can easily be part of that program with full stick of that help with that.
Thank you for sharing. Well done.
I was just really sad and I really, I didn't know what to expect coming into Full Circle. I joined about a year ago, for a little while before Colorado Springs opened up, and I first actually was the one that brought me into the program, and I didn't know what to expect except for knowing that when I got there, that feeling of home was the first thing that I immediately felt walking into the Everything that Full Circle has offered me has been nothing but like. Just love. I have felt so much love coming to this program and it literally has saved my life. I would not be here today without this program. I am so eternally grateful. So,
Appreciate it. That's a data we can't always quantify out here.
Any final questions for our first, Thank you. Thank you.
Thank all of you.
So it says we just go over the application and talk about neglecting at the end with that in mind, and the next application is. The students would be Tessa. And transfer that, there's on gauge, and we'll have some standard questions. So can Tessa, that's what it's like.
See you again, it needs a meeting calendar.
So after council action materials, they've read the applications, we put together some main objective for you, some pros and cons. List your budget up here, they have a more transfer document in front of them that talks about your application in a little bit more detail. This is your budget, I'm gonna go right to the one slide you produced and sent to us in advance, which is this slide, you have 2 minutes on this, what for you if needed. And they'll ask you questions, because the goal is not you stating program to have that information. The goal is really to make sure that we focus on the outcomes with it, which is one of the process. So with that, please take it.
Hey, for those of you that don't know me, my name is Ann Markley and I'm the CEO at Testa. Thank you so much for having us here today. We appreciate it. This is Susan Searle. She is our outreach and prevention specialist in our program as well. So for those of you that are familiar with us, you know what we do in the community. You have that in front of you again. What we're here today is really to talk to you about the multi-pronged approach that we're looking at to be able to support the youth specifically that come through the doors at Testa, or those that we can reach in our community. We know that kids that are exposed to adverse childhood experiences or ACEs are 10 times more likely to get involved in substance use at some point in their lives. And domestic violence is one of those major factors. So with this support, what we're hoping to be able to do is increase the amount of youth that we're able to reach within our community, as well as the outcomes that we can have for kids that are in our Safe House program. So kids in our Safe House program with the then the prevention piece, I'm going to let Susan talk about here real quick. Really from a Safe House perspective, that is getting those youth involved with a case manager, getting them with a trusted adult, helping them to identify risk factors in their lives, pro-social behaviors, what things that there may be risky behaviors that they are participating in right now, risky behaviors they've seen, and how we can take them and grow them from that and be able to then get them into a safe and stable environment post their stay in Safe House. We do that through a members assessment. We're able to look at where they are when they come into our Safe House program and where they are when they leave. And again, be able to show that 90% increase in understanding of risk factors and how they can grow over time. I'm going to toss it to Susan real quick to talk about the outreach.
Thank you all for your time. We do a pretty expansive outreach already. We've been working a lot to build partnerships in all of the school districts. We've been in 11 of the 15 school districts in this area. And again, we work really closely building partnerships with counselors, with teachers, with principals, with SROs. And so they invite us in and we come in and we do outreach with everything from, last week did second grade. So we're doing K through 6. And then middle school and also high schools. And so we are super passionate about prevention because we know that a lot of the behaviors that young people develop in that early adolescent age, if they don't change those behaviors, it's going to follow with them into adulthood. We know this. And so we're really working to help them learn about boundaries, learn about consent, learn about appropriate behaviors and just be better human beings all together. So we just want to share with you without is myself, my full-time job is outreach. I have one part-time person. And in this past year, we've had giving to the school districts of Colorado Springs over 300 hours of free prevention hours to the students. We've reached, again, 11 out of 15 of the districts. We've taught to over 10,000 students this school year alone. So we're, again, very passionate about being able to come into the classroom, create that safe space, give kids an opportunity to talk about what's going on in their schools, what's going on in their homes, and then provide them with some prevention information, healthy relationships, bullying. That's probably our #1 thing requested by schools. How to prevent bullying, what to do if you're in a bullying situation, talking about mental health and coping skills. So I just want to share with you really quickly some of our friends, our partners at some of our school districts. This comes from Jamie Montoya DeSmit. He's the D2 Mental Health Service Coordinator. He says, Tessa is more than a service provider. They're a dynamic partner for our district. Their team leads engaging classes on healthy relationships, personal boundaries, providing practical learning. They're also always available to us for consultation and strategic planning. Today, D2 had a leadership summit. They had a group of young people there and they were giving testimony. And there was a young girl there who was talking about how she got into vaping. And she said she ran into one of her friends in the bathroom and was pressured to try it because she didn't know how to say no. And so we're trying to really help young people find their boundaries, decide what your boundaries are, and then learn to say no. Stand up for yourself.
Side quick note.
Yeah.
I was like, what?
So with that in mind, let's open it up for questions. What questions do we have for Tessa? Please answer them too. Starting with her.
Magic. So question on the expand from 10,000 to 15,000. I'm curious what that looks like, because that's a lot of kids and there's only one plus a half people maybe. So is that a one and done? Is that like a school presentation and an assembly? Exactly what does that look like for interaction?
It depends on the school and what they would like. We are super flexible in letting them decide. Some schools are like, we just want a one and done. Some schools we have an ongoing relationship with, like, West Middle School, for example, we were there every single week, going in and doing program for a period of time. Some schools we go in once a month. We're usually there quarterly, like we usually do a fall and try to get back in with the spring. It just depends on their scheduling, allowing us to come in. But we prefer not to do the one and done because we know we have more success if we have more ability to build relationships with the kids and they get to know us.
To answer that as well, that is an unduplicated network. So that is individual children that we are reaching. And again, like Susan said, she's doing right now, she did 10,000, but basically herself and an additional staff member this year. So by adding that additional staff member, at the very least, we anticipate 5,000 more students reach.
Yeah. Yeah. If I don't mind to elaborate, sometimes we do what's called a takeover, where the school will ask us to come in and we'll be there all day long doing every single class, like all the English classes or science. So myself and my coworker will take the class. Sometimes we'll be together, but a lot of times we're on our own for that entire day.
An additional question. Sure.
Yeah, so, somewhat familiar with Tessa, but there are some words on here that I'm curious about. So you have housing first services for youth and families. Housing first is pretty controversial because a lot of folks that would say that housing first doesn't work well. And I'm saying Tessa and your case management I wouldn't necessarily put it in that category. So can you just explain to me what you mean by housing first?
So I didn't level set housing for this one.
Yeah, so it's really that there's no barriers for them to be able to get safe and stable housing is what we operate on. And so they do have to fall under having had a victimization of retreat star, which is EDSA and HDR star. And then, but the other factors don't come into play. Not looking at not being able to place them because they themselves do have substance use. We will give them supports to be able to help with that. There's some partners in our community to be able to get supportive services for adults that might have substance use disorder or whatever. But that that's not going to prevent them from getting safe and stable housing. And so what we do is we do a stair-step process of being able to, whether they're in our state house or not, through a transitional process of getting them into housing, we pay a period of time for rent for them. And then over time that goes down as they're becoming more self-sufficient. So while they're in our safe house, we're working with those families to talk about what that's going to look like for them to move them into that facility.
So I'm hearing that the initial barrier is not there, but there are requirements for them to stay in that housing then, or can they continue to use opioids and get support from your organization regardless of that?
So once they go into their own housing, we're just providing some rental assistance, and that's through another fund that provide the assistance through, we get rental assistance from a federal fund to be able to do that. And those barriers are not present for that specific grant. We don't sign the lease, they are in the lease of their own word of rent. As far as other programming, there are other measures they would have to meet to stay in our other programming to make sure that they are continuing to move forward and healthy, et cetera. And again, that's where we would engage with some of our community partners that have it. She's working today too to be able to provide that support.
One more, and then, I also on the slide, it said culturally responsive bilingual staff, inclusive trauma informed curricula tailored to community demographics. So what does that look like?
So we have multiple bilingual advocates on staff that work within all of our departments. And then we have ongoing trainings that we provide to our staff once a month on different special populations. Working with special populations, whether that be our deaf or hard of hearing community or LGBTQIA community. We have those trainings throughout the year so that our staff is always well versed in how to be able to work with different populations.
Okay.
Any other questions?
Yeah, this real quick, and thanks obviously for being here. Love what Tessa does, obviously. Can you tell us, is there a way to quantify if you win this money, the impact of what this money is doing in the community from you guys?
Yeah, so everything that we do pre and post assessments within our education and our schools for sure. So everybody, both the schools and the youth do get a pre-assessment and a post assessment for their learnings. We do look at long-term outcomes for our schools too, to be able to engage in that way. Those individuals that go through our safe house program specifically, which is what we're asking for too, we do those ongoing assessments that see growth over time. And those are all numbers that we can report back to. We do track all of that in our Salesforce tracking system to be able to look at that in those percentages. And that is a set, the movers assessment specifically is a set assessment that we get from the state from domestic violence programs to be able to assess them over time. And we have to do that when they come in, middle stay, and then exit, and then we follow up with post stay too.
Thanks.
Any additional questions? Okay, thank you.
Thank you. Well, there's time.
And then in the past, there's times as kids to come back up, so hoping Tessa can stick around, all the applicants can stick around, just in case they ask to come back up or for question and clarification. Next up, from the front is Casa of Pikes. Thousand. What I love about your budget is laid out how much you were paying versus how much the region's paying in the section. Thank you, that might be required. Teacher kid. And right to your one pager. I think you have a lot of data on your one pager. So you've got 2 minutes to deliver. 2 or 3 minutes. Yeah. So please take over.
Thanks. Everyone, I'm Angela Rose, Executive Director at Casa Pikes Region. With me today, I have Elizabeth Alba, who is my friend development director, and also Kelsey Daniels, who is our grant specialist. Someone's been supporting the most vulnerable children in our community for over 36 years. We have a 4-star rating with Charity now, where 86 cents of every dollar that we spend goes right back to our programs and the kids that we serve. We have a long history of clean financial audits and years of experience with these kind of grants and tracking data. Case supervisors, who the salaries that you saw, that's who those salaries will go to pay, will train and supervise volunteer advocates assigned to the Region 16 Opioid Council cases, who will provide direct services to child victims of abuse, neglect, domestic violence, and most importantly for this group, substance abuse. Volunteers will have the goal of providing safety and advocacy, reuniting families, which we know is what's best for kids, increasing protective factors and pro-social behaviors, decreasing youth substance abuse, risky behaviors, and faulty perceptions of drug use, and help get children and families out of the judicial system. On the left side of the slide, you can see some current outcomes. These are 3-year averages that I pulled just so you could see what kind of results we're getting. So number of children that had a case with an opioid impact, you can see was 35. Number of children with a substance abuse impact was 131. Number of families that we reunited that had an opioid impact was 13. That's like an average of 13 a year. Number of families reunited with substance abuse was 57. Number of families we exited from the judicial system was about 223 a year. Number of children who received youth prevention services was 116. Then more specifically under youth prevention to help those kids get away from those risky behaviors. They can get things from us to the hangar store, and we also had 181 participated in our team programs and life skills classes. In addition, we're bringing in about 100 new volunteer applicants a year to serve these kids. We do well-being assessments, and 93% of our CASA advocates provided developmental support for kids through those assessments, and 59% of those kids received educational advocacy. And then things we always measure, 99% of the kids did not experience re-abuse or neglect while CASA was on the case. 83% of the children had no more than 2 placement homes, which is huge for their development. And 77% of the children achieved permanency within 24 months. So if you look on the right side, you can see at the very top, our plan with this $50,000 is to serve an additional 26 children. And those would be 26 kids who are impacted by opioid abuse or substance abuse. Sometimes we don't know specifically that it's opioids. A lot of times we do. And then we'll track all the items on the right side, and by the numbers I gave you on the left, that should give you kind of an idea of what kind of outcomes you can expect for us when we're actually tracking those numbers. I believe that investment in CASA is an investment in our community, the children and the families who live here. These innocent children are placed in unsafe, traumatic situations, which is no fault of their own. They love their parents, they just want the bad stuff to stop. If we can change the trajectory of these children, we can stop the cycle of drugs, abuse, and neglect, not just for these children, but for many generations to come. CASA is a part of the solution, and together we can protect the innocent children who are victims of opioid abuse right here in our community. Thank you.
With that, I'll put it back to the slide, and you can chat on this slide.
No, I think those are case supervisor positions that you would help us.
Your case supervisors here that we're helping to support, are this existing? Is this additional staff? How do those fit into your organization?
They are existing case supervisors, so they're already trained up and ready to go.
Other questions?
Very much. Thank you.
Steve. Joint prevention, strange. Main objectives of the board rules right in front of you and ask for 295, 610 decisions. Here's their full budget. And then I'll go right to their 1-page slide that is outcome focused. With that.
Hi, everybody. I'm Kelly Furtado, Chief Operating Officer for Joint Initiatives for Youth and Families. And with me, I have Cassie Reyes, our VP of Pathways. Joint Initiatives hold several legislatively mandated roles within our community. The Colorado Youth Detention Continuum, as well as the collaborative management program, or both house urban joint initiatives. We pull together local stakeholders who work with youth and families and come up with, community goals for building systems that help youth and families thrive. What that committee determined was a need in our community a couple years ago was what's called a juvenile assessment center. And many communities our size already had one. We didn't yet. Joint Initiatives opened one last November. It's called the Ascend Center and is located in one wing of Galileo Middle School, but open to all youth and families within our community. We're able to provide a series of wraparound services to youth and families. And it's really as soon as youth are, showing signs of being on the wrong track, we'll get a referral, and then we determine what services are best fit for them. And we wrap around the community, right, with the youth and family in the middle of that decision-making process, that plan building process. So instead of what youth and family many times receive, which is, oh, you've gotten yourself into this situation, here's the laundry list of things you need to do, put them in the middle and say, what do you need? And then partners from the community wrap around and provide the supports that they've identified. So what we are looking to do is increase services that we provide within the Ascend Center. We have wait lists currently, both for our individual service planning teams, as well as our care coordination. And so we're looking to increase those services. We also would like to increase the number of English language learning families that know about the Ascend Center through outreach. And we would like to continue to build out respite for parents who are in challenging situations so that they can come to the center and receive care and planning, as well as building out after school and summer programs for youth, peer mentoring and support circles for youth as well. All of this working to prevent the risky behaviors and drug use that we're seeing within the population that we're serving already. We serve around 900 individuals with ISST annually right now, and around 300 through coordinated care. 150 through coordinated care. So we're looking to increase that. We do have really high success rates to date in the 90 percentile for youth and families completing their plans with us. And so we're anticipating similar outcomes with the expansion of these services, as you'll see here.
Okay. Any questions for our?
You pop back to the other slide.
Budget slide, yeah. Anything to add to the slide or anything you want to unpack that way?
What I would like to unpack is that with the personnel, we are looking to hire an additional ISST coach, an additional care coordinator, and bring on a part-time daytime family coordinator that we would fund the other half of through another funding source. So there are 3 new positions so that we can meet the community need. We're current wait lists.
Questions?
She just answered the ones that I had, so I think.
Any other questions you want to cost on?
Joint initiative.
Joint initiative. So, tell me a little bit about your overall approach to long-term sustainability, because you have a ton of money. I mean, everything's grants pretty much for you, either state contracts. We're going into a season of difficulty there.
Yes.
And you're expanding during a season of difficulty. So tell me about your approach.
Yeah, so yeah. I think our approach is twofold. We referenced in the application that first and foremost, we work on building partnerships where we're, doing collective impact work, leveraging local funding to reach collective impact goals. So that's one strategy, and the Ascend Center is helping to bring those partners under one roof to help with that. And then secondly, thankfully, a lot of these funding sources have to date been reliable. And I know we're, working into a year that may become an issue. So what we're doing is really diversifying funding and ensuring that we're reaching out to any funding source that can support this. Also building philanthropic dollars that we haven't tapped into yet. JI had historically been a systems building entity, but now that we're in direct service, it allows us to tap into philanthropic dollars.
Okay.
Okay.
Your questions?
I do, yeah, thank you. So one of the things that I noticed is that there's a lot here in terms of those wraparound services in all kinds of areas, but we are obviously the opioid council.
Yeah.
So what mechanisms do you have to track any of that opioid use and what your effect is on opioid use and prevention specifically? And are you targeting, is there a target specifically at-risk kids that you're working with there, or is it just kind of more general population?
Yeah, it's absolutely at-risk youth that get sent our way. It's when situations are more complex than one system can deal with. That's when they get referred to us. And we are utilizing the CANS assessment, the Child and Adolescent Strengths and Needs assessment, to see what that individual plan needs to look like. And we utilize that tool over time and ensure that we are helping youth and families to complete the plan that is created for them. Through this grant, we're looking at extending our outcomes work even further because we want to see long-term what the impact is. Right now, we know what the short-term impact is, but we would like more longitudinal data. We enter information into the HMIS and also have satisfaction survey data as well as the assessment data.
Are the plans specific to substance use? I guess that we're talking about big terms, which I understand, but I'm trying to understand what your nexus truly is to substance use and opioid use.
If a child is coming to us with those needs, then the plan is centered on those needs. They're highly individualized plans, but absolutely, it's a high percentage of our population who, is using.
So will you be able to report to us on how many of those are, how many of those plans are based around that substance use?
Yeah, absolutely.
And what would be your goal, that just in terms of how we track that, would that be successful completion of the plan for those individuals that you would be willing to report to us on?
Yes.
Okay, and can you give me an example of what, I know that they're individualized.
Yeah.
But when you have a plan, an individual who, or, youth who is dealing with substance use, and this is kind of the prevention bucket, so I guess.
Yes.
In this case, we're talking about maybe preventing them from using it further, I guess we'll say.
Yes.
But what kind of a goal would you have in that plan? What would success look like?
Yeah, I'll give you an example of what might be typical for a youth who is using. If they are open to receiving therapy, then we'll connect them with a partner who's able to provide that. Many times they would like a positive adult mentor, and so we'll connect them with a mentor. And we also typically have outcomes. Sometimes they're driven by the court, right? And so we want to ensure that those goals are met as well. And we always look at, are they engaging in school? That's another, piece of the puzzle that we're looking at. And so we see that through plan completion. So we'd be able to report out if, they went to all of their appointments, all of those sorts of things that came up that end.
What about any kind of measurement? So what is the time span typically that a plan would be? At what point do you say the plan is complete? Is that just solely based on the goals within the plan, or?
It's based upon the goals, but I would say typical is 6 months to a year.
And then do you have any method for those kids specifically around that substance use where you would be able to go back and track, are they still not safe?
Yeah, and that is what we're looking to build in is the longitudinal data. Yeah. Yes.
Similar to Carrie's, where I'm trying to understand, so you're saying you get about 1,000 referrals?
Yep.
So when you're reporting back the data that Carrie's asking for, is that gonna be an aggregate of 1,000 plus whatever number you can do? Or is it gonna be focused on the additional that we can?
We were planning on it being the additional, but absolutely can report out in total and pull that
I
out.
just didn't know whether it's just going into the big bucket or whether.
No,
it's separate.
Yeah, we can pull it out.
Any final question? Hearing none, thank you.
Thank you.
On it, please stay in the room. Well, last applicants in the region prevention section. These were a chance to apply as much as it. So among the past, what chance of growth of less than 194,000. They have their main objectives of the programs. This group also came to present to us the past as our community members, allies on any range. The benefit of this group. Here's their budget. Then we have their slide here, which highlights their kind of return on investment with their data. At the end of each of the 3 minutes, I'll go back to the budget slide. You can further unpack that and all kind of questions.
Sounds good. Hi, I'm Diane Carlson. I'm co-founder and I'm a policy director for One Chance to Grow. And I just want to say hats off to everyone in this room and the important work you're doing. And that youth prevention is the most life-changing investment that Region 16 can make. Research shows that adolescent marijuana use is a strong predictor for later substance use disorders, including opiate use disorders. A recent study found that early marijuana use was the #1 indicator for developing a future opiate use disorder. Another study shows positive associations between marijuana use at the age of 14 and opiate use at 19. Increased retail marijuana can normalize use and lower perception of harms, and yet we know prevention works. That youth, 72% of youth say that they are less likely to use marijuana and other substances if their parents disapprove or a trusted adult disapproves. For over 12 years, we've worked at the state and local levels to educate and equip parents, schools, and youth-serving organizations with real facts and practical tools to protect kids. We've driven multiple public awareness campaigns with measurable outcomes, helped pass landmark local and state protections, and built strong, trusted partnerships from Colorado and in Region 16 to reduce youth access and use. Our education efforts and secure youth safeguards have been attributed to lowering youth marijuana use and access statewide. I'm Julie Dryfall. I'm the Director of Community Outreach, and experts in prevention continually tell us statewide and nationally that educating parents is the missing link in prevention. So we are here to talk about that. So when informed adults are better equipped to recognize what today's marijuana looks like, what these products are, and the potency of these products, they can therefore engage in these meaningful conversations with their kids and set clear boundaries. As Diane said, 72% are less likely to use if they know their parents don't approve of it. So youth prevention, we believe, really starts with adult awareness. In Colorado Springs and in El Paso and Teller counties, we've got great relationships with former Mayor John Suthers, Senator Paul Lundeen, of the Alpamar Foundation, the Pikes United Way, the Boys and Girls Club here in town. And we have great relationships with several of the Teller and El Paso County high schools and middle schools. So we really feel like, and also we have a wonderful, meaningful and dynamic relationship with the Denver Gazette and multiple radio stations here in town. So.
I'm Allison Dodge, and I am the donor and philanthropic relations person at One Chance to Grow Up. And with your support, we will reach thousands of parents and youth serving adults directly, and tens of thousands more through schools, workshops, webinars, billboards, social media, while optimizing our earned media. The CDC estimates a single case of opioid use disorder costs over $220,000. And this does not include, as you know, the heart-wrenching human costs. And one fatal overdose is $11 million. With this funding, the return on financial and emotional investment could be tremendous. Our history shows that we don't just talk about protecting kids, we do it, and we engage others to join us. A child born today will spend 16 years under this current opioid abatement agreement. Upstream prevention will ensure that all children will have the chance to grow up healthy, connected, and drug-free. Thank you so much for your leadership in protecting Region 16 kids, and we are happy to answer any questions.
I would have questions, any budget, anything bad, budget on my.
Questions if you have, or, I mean, I just would like to say that our whole organization is all in on this. And we have been very involved in Region 16 in many ways, including from a policy perspective. When marijuana was first legalized, we realized that this also is about all substances. But that there is great misperception about marijuana and the emerging new substances that are coming out. And that's where we really have expertise in educating parents. When it comes to the budget, we will have our co-owners, our executive director, unfortunately, she could not be here today. We will have a project director, which is Julie, on board. We will have a project manager managing the costs and our vendors that are involved. We will engage a communication firm that is expertise is really in behavior change, pro-social behavior. As a matter of fact, they've been involved with Rise Above, and they've been doing the surveying of the youth in Teller and El Paso County already. So we've already got a lot of that data, which is really helpful. And one of the things that they found was that the kids in those counties do perceive the things that you can buy over the counter or in a dispensary as less harmful. It's like a real issue. This hemp-derived, psychoactive hemp-derived is another real issue, and the psilocybin that's now being rolled out as well. You know, we're hearing public health departments are talking about that now, and we are well versed in that. So while we say direct personnel, that will be somebody on the ground in the community we've worked with before, as well as our entire team. When it comes to program development, we really want to add to the content, the parent toolkits. We'd like to expand on the substances covered in that information and the content of that. And do you want to dive in, Julie, with anything that I'm missing? We'll have a website that will be put up. We'll have a plugin that will be monitoring, doing pre and post surveys, as well as we'll be doing pre and post surveys with the events that we're holding, the actual events. So I think we'll, yeah, sorry, am I talking too much?
Yeah, and actually the other slide that you had there when you're talking about the deliverables that were in there, a lot of things are tied in there to CDPHE health warnings. Is that CD? No, the other page talks about focus groups and that market research. So I don't have a lot of faith, I guess, in some of the messaging coming out of CDPHE, to be honest. And I think a lot of that actually comes from kids who come and talk to us here about the things that they listen to, the things that they don't listen to.
Yeah.
And you talk about trusted adults, but also it's just, for where that messaging comes. Can you talk a little bit about though, are we regurgitating CDPHE messaging, or are we trying to hit kids where they are from trusted sources?
So I totally appreciate that.
CDPHE has public health statements, and one of them is that early marijuana use is a direct contributor to opiate use and other substance use. So that's a message that we would grab into. I agree with you on some of the messaging. The other thing is a mandated for THC, there's 4 mandated warnings for high potency marijuana that's we created billboards for down here and in Denver recently. So those are mandated warnings that come from a legislative mandate that a bill that worked on. So that's not necessarily CDPHE, but those are warnings that high potency marijuana can cause psychosis, it can cause addiction, it can cause cannabinoid hyperemesis, and it can cause addiction. So those are really basic messages that have been tested and have worked with.
And I think it's the science that CDPHE can give us through their review of 60,000 scientific papers and presentations.
And then, just as a follow-up question to all of that is, when it comes to outcomes, is what is it? Is it awareness? Is it, you want them to do something when it comes from, because obviously there's a lot of marketing in here. So what are we hoping to achieve specifically, from this? Obviously awareness is part of it. But are there specific actions? What are you hoping for outcomes? Because we can see that, well, we're gonna reach and all of that is that, okay, great, fantastic. We're gonna reach them for what end?
Yeah, the biggest problem is prevention is so hard to measure, right?
Mhm.
So we have to kind of back into that, and so.
And I think Healthy Kids Colorado survey data would help us understand that if youth use rates decrease, and I know not everybody participates in that study in these two districts, but I think that might be a really good caveat to look at to see how those youth use rates and the perception of harm. I mean, I think that's what we need to really analyze too, is we know when commercialization happens and kids see it everywhere and they see it as medicine, that they don't realize the harm. So I think perception of harm, that would go up, that would be it.
Yeah, one of the issues I know that I think I probably say we, because we've talked about it before, is have issues with, for example, Healthy Kids Colorado, and actually one of the state director from Full Circle said critically, which is that kids lie. And when it comes to Healthy Kids Colorado, kids lie. That's data, which is why we've actually contracted to hopefully get better data from all of this. So that would be my only word of kind of caution is that Healthy Kids Colorado, I think, and God bless them for trying, but kids lie.
If it's been lying for 10 years and it goes down, that means it's still going up, right?
We totally agree with you, and this is very community driven, and our whole goal is to reduce substance use, reduce risky behaviors, increase pro-social, show alternative methods. We would definitely integrate the motivational interviewing. Many ways we can leverage the T on THC campaign. We love that stuff. All those things. And what the research shows is that people don't have the information. They don't even know that some of these products are harmful. They don't know how this impacts the developing brain. And our whole goal is to really say what these substances do to the developing brain and try to create a consensus with the adults that no matter how you feel about adult, drug use, any drug use, legal, illegal, we can all come together and say, hey, this is not good for underage kids. And we find that's a really unifying message that people can really jump on, and it takes the angst out of all these different views about substance use. Sorry, Julia.
No, absolutely. And I think we need the funds to create new resources and push out a lot of this information right here, that substance use begins before 18. I mean, like we talked about, using opiate for THC at 14 is directly linked to opiate use at 19. So that's new data that's emerging that we want to push out.
And the brand new research is showing that it's the 25 and under that actually don't or less likely to have this information and are less likely to have alternative coping skills. So really that's what this is all geared towards, and kind of getting everybody on board so it's all the same messages, because the kids, they will just tell us this is a nightmare, this landscape, they don't know what to say when they don't want to use it. They don't want to be uncool, and a lot of the adults make them feel uncool. They're telling us when we do these presentations, will you go talk to my principal and these other adults in their life, because there are these perceptions about what these products are that are not really what the products that are out there. And so that is the feedback we continually get from kids.
And I feel like in Region 16, it's shown by how many people are here today. It is such a tight community. And if we can do public awareness, parent awareness, trusted adult awareness to bring the entire community together in understanding the connection between THC and opioids, I think it can be done here. And we would love the opportunity.
From the janitor at the school, to the mayor of your city, to the coaches, to the parents, to the teachers, to the city council, I mean, you guys all care about your.
I mean, I believe this is the place that could show the rest of the country what we could really do for kids. This is a place that really has the guts to put the kids first. And the other thing that would do is if you got the adults kind of all in on this, you know, seeing that, okay, whatever we feel about this, we got to look out for our kids. It would drive better policy, youth safeguards at our schools, locally, as all these things roll out in Colorado Springs and Tower County, it will get more adults that are supportive of these safeguards, which are going to make all of your jobs so much easier, and it's going to reduce the negative outcomes that are really devastating. I mean, you guys have seen what's happened in Denver. I mean, it is so sad what we've watched happen with marijuana and the drugs in Denver. And I believe that Colorado Springs and Tower County is gonna damn well make sure it doesn't happen here. And that's why we're so excited to be a part of it. We feel like this is a place that really, really wants to make that happen. So we really appreciate you prioritizing more of this.
Any questions?
Yeah, I do. So understanding all the things that you're saying about how difficult it is to track, prevention, right? And the results of that. However, you mentioned a couple of things. And one is, I think, as we gather data as an entire, opioid council here, we're gonna be looking at all of this data about, you know, usage and sadly, the coroner's data and all of these different pieces that I think we will have a role in assessing whether or not prevention activities are being successful as well. But specifically, we've talked about healthy kids. I could go on for a long time about that. But you mentioned the Rise Above data.
Yes.
And so can you just touch on that and how that might be a helpful measure? I've heard a little bit about it, but I don't know a lot.
Yeah, I mean, to be honest, like, yes, we think that can be a helpful measure. And I know that you all have funded projects where they are gathering data. And we appreciate Rise Above. We partnered with Rise Above. We've all been involved in CG's efforts. And a communication firm that we've worked with extensively over the years on our activities, they've also done other substances. So they have, that's been our focus. They have experience in other substances and they are doing the work with Rise Above, and they would participate in this grant with us.
And then the other piece is, obviously the reason that we do focus groups are to extrapolate that data. You mentioned surveys. Have you done any of those surveys with focus groups to this point that maybe you could share with us? Or if not, when you do those focus groups and you're doing the surveys, I assume you're going to do a message test. You're going to ask people, did this make you more or less likely to, you know, utilize drugs, and we can extrapolate that to the larger population. I'm guessing that is the idea.
Yeah, absolutely. That will be a big part of it. And again, you know, while the three of us, that's not our expertise, we have a partner that is their expertise, and we worked with them for 12 years.
And we're nimble enough that if something's not going right, we can pivot. I mean, we've learned that over the years. Our organization is like, sometimes what you think is going to work and it's testing work is not working. And so we're able to.
And we would love to help in any way with the data. I mean,
We all are always trying to figure that piece out. I feel like it's challenging. Yeah. Thank you.
Further questions, for Chancellor Long? Okay, hearing none, I think we're gonna get to the analysis stage here. So thank you.
Okay, thank you.
Stay on
Thank you so much.
So, what you have in front of you is a document that we charted and we're reminding of. That the report over these got in late January. So now we're at the point we've heard from all the youth prevention groups. There was one group that had applied that I spoke to this week, spoke to a couple of them this week, and it was with the shooting range. And they actually had a material change in their application where they one school they thought they'd be able to partner with, they couldn't partner with. They also highlighted with a request of 100,000, maybe only be serving 6 students. So I asked them to maybe think about coming back in July, maybe working with the other. There are other shooting ranges involved as work. We're gonna bring it back together in the July session. So this would be in June, July. So with that in mind, I'm gonna go to the slide that highlights the funding that's available for the market here. We have it broken up by segment. We don't have to normally put, same amount of funding in each section. We can't say we're gonna fund more in one section versus another. But to highlight it, here's the funding request that came in for SOW. This was after calling the groups and clarifying what space people wanted to put themselves in. They sometimes chose to. Interesting family advocates, I think for the future might be something we have to highlight there, looking for that. And some of these groups did have family advocacy, but when asked which one section they would choose, none of them chose family advocacy as their first section. So today we're talking about that amount of 13255. You have information in front of you.
So actually, though, the number six got pulled, right? So it's less.
Correct, yeah, minus the 100 is that whole. So with that, maybe we start at the top. Youth, the full circle plan, they're still in the room. As you know, they're asking for their number. Let's go to that, the 232. Sorry, on this for the collective for now on. We have the opportunity to discuss a little later.
James, can we go back to the full list again? I don't know if it's, and I don't want to get in front of you very good specific material.
I'm actually going to maybe ask, or suggest perhaps that maybe we allow a little bit of discussion before we just go straight up and down votes, generally, because, yeah, just generally about what we are trying to achieve. I think, we can drill down to the details, but also we still have a big picture discussion of trying to achieve. And I don't want to cause anybody to panic or to say, like, we might want to have questions, are some of these duplicative? Do we feel like they're competing with each other? Would we want to have both or all? And I'm not saying that anything specific, but I just think a holistic conversation might be useful for me.
Well, I can weigh in a few observations. The last presentation, Chance to Grow, was pretty focused on marketing and not really like infrastructure driven or any of that kind of stuff. And so, and not to say that marketing might not be appropriate, but it is just marketing in 1 year. And so it's not something that I thought was very sustainable because it's a one and done thing. And then the other thing that I kind of did notice was that on the joint initiatives, I really like a ton of what they do, but 78% of what they're asking is for personnel. And that is like an annual, that's gonna be one and done too. And so there's not really something that's sustainable in that piece either. So those were two things that I kind of just picked up on. So
Well, I see the one Chance to Grow differently than you. I see it as education. And not marketing with billboards and education to parents, and like you said, and with us just getting recreational marijuana off the ground in our city, I think the education is the most important thing we can do.
these billboards, something like
I'm just saying it's not, I mean, that to me, I see education. Like if you're driving and you see it, oh, did you realize we now have recreational marijuana? I don't know that the majority of people know that's now on the street. It's hitting the street. Now the dispensaries are saying it now. They're putting their signs up that say recreational too, but I see it more as education than marketing. And I don't know how many people realize that it's already hit the ground.
But is there a question about, so the thesis of that is that usage of cannabis leads to opioid use, and so we're kind of we're steps away from the fact that we're trying, the money is allocated for opioid use, and this is based on the theory that they will progress this.
Well, I would argue that we have data that shows us that it starts there. And so if we're looking at prevention and upstream, it makes absolute sense to me to start there. I actually, I think it is very difficult to measure, but to me, that honestly, that is the single most important thing we can do right now for youth prevention, in my opinion. Because when you talk to parents and others, I can't tell you how many times I hear parents be like, "Oh, it's not a big deal. I smoke pot when I was a kid," or "It's not whatever." And especially with the high potency THCs, and having unfortunately personal experiences and watching kids go from this to the opioids, I just think that if we can educate parents, teachers, and even kids through these, we will have a community who is working together to say, hey, this drug culture that Colorado has created has got to change if we're going to make significant. I think this is the single most important thing that we do. And I hope that the data bears it out. That's always a really tough place, but in prevention, that's what we're going to have to do. But to me, this is that thing most important.
Yeah, thank you. Yeah, I think honestly, the comments made, by Commissioner Geithner and Councilmember, Phil Iverson are spot on. And not only do I think, and I don't view this, this marketing effort as a one and done. I actually view it as we've got a tiny little bit of recreational marijuana available in Teller County, but I would think for the majority of the county, the fact that Manitou Springs is at the bottom of the hill, highly available, and now it's, I don't know how many locations there are, and it will be
80.
in Colorado Springs, so it'll be a lot.
80, so
80, okay. Is that I think education is critical, and I don't think I disagree that it's one and done, because I think we're gonna be back here saying I will be back here saying, well, we need to keep doing something, if not this, something like this. And when I view it, I mean, I'm an old marketing guy, digital marketer for many, many years, and I look at it, it's like, it's not just billboards, it's a lot of different things, it's a lot of different media. And part of that, I think, is in the focus groups, and also is there are now so many ways marketing wise to reach, and we're mostly talking about under 25 here with this, because you got to reach them where they are. That's what marketing is and always has been. And believe it or not, I mean, I was actually happy to see that billboards were still part of it, because that's one of those medias that's a legacy media that actually does work when it comes to awareness. There are some other things that are older media that, I mean, for example, television right now, you're not going to reach an under 25 age person, but among the digital marketing groups that I've been involved with for many, many years, and I'm still plugged into, even though I'm not doing the work, is the areas in which you can reach people, drilling down into video games, drilling down into different gaming type platforms and content platforms, whether it be TikTok or others. You got to reach them where they are. I think I think it's critical. We had, the presentation, was it What Chance to Grow that came in earlier, or who was it that came in and gave us that presentation on THC?
It was just now, it's also One Chance to Grow, any class.
Yeah, they're a part of it, but Carrie's exactly right. I mean, the data is super duper clear. If they start hearing the high potency THC, really high propensity, and boy, if you could stop them before they ever get there, I think we've done something. And it sounds like a big ask. I actually don't think it's that big.
well, if you ever drive I 25 in the state, you don't have a choice but to read us billboard, because you can't go anywhere.
Well, and CDOT has a goal of
You have to read them.
more congestion, as Holly knows. We talk about it all the time. They removed the goal of reducing congestion, so now captive audience.
They're a captive audience, for sure.
The only thing
On trains.
Commissioner, the only thing I can say is from the enforcement side of the house, after 2 decades in this business, is everything about that is spot on. Without making any crazy references to any Nancy Reagan campaigns about just. Maybe I am, if not, what worries me too is some things that are being laced with marijuana. It's just not the high potency stuff, it's what you pick it up. So the education component, to me, from an enforcement perspective, is
I guess I would have been probably fundamentally more convinced of it if we weren't a bunch of old people trying to determine what these people actually do. I don't think they look at billboards. And so I'm worried the marketing is being pointed at the wrong audience. And I'm not sure parents, I think parents are a key component to this whole thing. I don't want to disregard that, but often there's this separation that happens. And I think the strongest piece by far is peer-to-peer. Peer-to-peer with these kids at this point, I believe that kids listen to other kids. And that's what TikTok's all about. That's what all these other programs that really are being effective. I think that's what's really key. Peer-to-peer is this generation, clearly. My generation, I sit in the park of the I-25 with billboards. The ones that say, billboards work, you just read this.
Well, you mentioned that they're in the room. Why don't we ask it? What do you guys usually look at for marketing? What gets your attention?
Oh, I don't know if you like the segments. Like. Grab your attention to issue. Not, all of this will work, you just do these, but it like, it's gonna try to catch your attention on those. Something that's gonna grab your attention, so it's gonna, kind of catch the eye. Or just get rid of it. Direction.
Okay.
I definitely agree with peer-to-peer. I also very strongly disagree with the SMART system. Specifically because I've been to schools and I've seen how little people often pay attention to how the things that they put out there. I see peer-to-peer action and that working way more often than I see things being presented in front of me. I go to a D11 school, or I used to, and I would constantly see people just sitting in the back of presentations and things that were coming up at school that people would talk about from teachers and like adults and staff that like nobody would pay attention to. It would just fly right over their heads. I don't think anything like that has ever worked for any teenagers that I've had experiences or like acquaintances with. But that's a lot of time. I think peer-to-peer works a lot better than anything else that I've especially with Full Circle. I've seen it work so many times. So many times.
Thank you.
So one thing that I would just comment on is sort of piggybacking off of different comments I've heard from different people. The digital marketing is measurable. You can tell what's happening with the digital marketing. To Dave Weinweber's point, there's a zero way to measure what's happening with the goal, whether it's being effective or not.
We do have a digital component that includes.
Yeah, I'm just talking about just pointing out the difference between the digital, which I think is good that we can get measurables from it. Billboards, we get zero measurable. Yeah, we can say that we look at billboards, but I don't know how effective they actually are in reality.
But that's a really small piece of it, but
It
I
is,
have
yeah.
found that we do the billboards, we leverage it because we do digital too.
Yeah.
There's an actual billboard and then we drive the media and we get a ton of our media. And just to also say, we definitely are pulling in our trusted experts. Libby Scout is one of those, who's a real expert in this field. She wants to be a part of this grant with us as well. And so it would be more dynamic than just the marketing.
Yeah.
We're definitely into connecting with youth and parents and the organizations. It's not just about.
Yeah, so that's where I was gonna go next, is that I agree with everybody else that has said that education is, I think, our biggest push, I think, in this, and that is to stop people from even getting on the path that ends up in opioids. I think that's a huge piece of it, and how we can harness that part of it, I think, is important.
The only thing I think billboards are very important for, and I just have seen one just most recently, and it had some data on there I didn't know. And then I looked it up to see if it was true, because I'm sitting there stuck on my
Probably
25.
not while you were driving.
I was driving.
When you-
5 miles an hour. This might be the end. We all do it.
When you need one.
Forgive me, there's probably. But to your point, like, how many people know that THC today is 60 to 90%? I mean, marijuana today is 60, 90%. It wasn't like in the 70s where they had 10%, they passed it around the room with 3 people, right? They're consuming 3%, not 60.
People don't believe that marijuana is addictive.
But I'm just saying,
Which
stat.
leads to other
So if you
addictions.
see a stat, just relax your smart.
I don't think there's argument about marijuana. I'm not disagreeing.
I know,
What's-
I'm just supposed to make my.
Absolutely not disagreeing with us. What I'm saying is the effectiveness of this market.
Yeah, is the money being used wisely?
That's kind of what I'm getting at. I would love to find good ways to deliver the message that marijuana is bad. Absolutely. And I think it is gateway drug to everything. So totally.
I was just talking stats, like, yeah, I agree, if you see, buy this house, buy that house.
That's like you and me. I don't know that kids.
No, I'm talking adults, I'm saying they're doing both,
Yeah.
but. And we have made the old man calm to me, I have to be like.
You're definitely not about, you're not living.
So I, we should not lose sight of the fact that this is not just for kids. So I think you have to remember that it's important that parents understand this. Because I think the total education campaign teachers, and I know that One Chance to Grow Up does a lot with making sure teachers understand what to look for in their classrooms, like all of those components, I think are part of it. But I also want to say, even though I've dabbled a bit in the marketing world, I have, you know.
You're gonna say it.
But I have a minor in marketing. I will not consider myself an expert in any way, shape, or form. I will say from my, you know, my personal experience professionally, I guess really was what I should say in the work that I've done. I would say that the layering is very important when we're trying to bring broad community awareness. However, I will also say I'm not an expert. I do know that the work that I've seen from One Chance to Grow Up has been exceptional and professionally done. So I do have some confidence as they're saying they're going to do these focus groups. That's what focus groups are about. It's not about us deciding today what the best methods are. It's about letting them work with those groups and finding out what is going to be the best method of delivery. So rather than quibble over what we think it might be, I think that they have a good plan with the focus groups and working with professionals in that area to come up with a good education campaign is my opinion. And I would be willing to take a gamble that it's going to be pretty well done from the things that I have seen from them. Because I actually have seen the banner ads with different things at different times that they have worked on that have popped up on my computer and taught me a lot about those particular points.
So, we spent a lot of time talking about One Chance to Grow, and we talked a little bit about joint initiatives. And then when people from the community and the respondents speak and remind you, these will come to the front so I can get it on camera for the tape. Why don't we go through the other ones and then continue the dialogue? So let's take it back to the top. So that was rank number 5. Number 1 on that list was Full Circle. So did we have any dialogue on Full Circle? Their budget, any questions, whether it was the remaining room, have to fill up Full Circle.
To hopefully shorten our time today, I think Full Circle is a no-brainer. They came here without us. They started something without us. They have a model that's successful. They talked about the success of peer-to-peer. We also need to be aware at the point where they're getting into Full Circle, they have a problem. And maybe opioid abuse, it might be high potency THC, it might be home situation, it might be depression, anxiety. There's a lot of reasons why kids come into Full Circle, but the reality is that they are a long way down the pathway when they get to Full Circle. I think it's a fabulous program, and to shorten the day, I just think that we need to approve them and talk about the other thing.
What do you want to do?
Just give me the rule about that. Formal vote, we kind of have to give a thumbs up and we talk about it. I don't think you do a motion or anything. So any other comments on this before we do the informal thumbs up? Okay, so.
Are we just doing a thumbs up to move them forward?
Yes, in advance of the process, there's still contract and there's still the outcomes and all that. So, if we get an informal thumbs up, we want to advance to the next stage of the process.
Yeah.
Okay. Anybody have a thumb there? Neutral thumb? Okay, giving that, let's move to the next one. Tessa is also highly ranked, right? Here is their thumb slide. So do you have any comments on Tessa?
Well, things that I like about what Tessa is doing is they actually are looking at increasing their services, increasing their outreach, increasing the scope of it. We all know that Tessa is a quality established organization. And on its whole, I don't have any concerns about this.
So remind you have a document in front of you, the cheat sheet. Any other comments on Tessa? We'll be able to punch on this too.
I think it goes without saying that one of their cons is the direct opioid use reduction metrics. Understanding that, I know how entrenched Tessa is with this community, and I think that inherently what they do will have a direct opioid reduction. I don't see how it can't. And with their approach, and I think everybody in this room is very familiar with Tessa, so yeah, thumbs up for me on that.
Any other comments or questions? Tessa,
I think I'd say I really appreciate when you're working with families and with the kids, because a lot of times the kids, we see the early trauma that leads to really bad outcomes. I'm not I question a little bit the effectiveness of those large school things personally, for the same reason the young people Heinz pointed out. And I don't think that's ever changed over time. I think a lot of us sat in school assemblies clear back, way back, and we just kind of sit around in the back. Pardon me?
Let's skip this. It's our time.
Wait. So, I don't know, I mean, I'm just saying that, I'm not, I think that part, I don't know if it's as effective, but definitely reaching the kids that are coming in with parents or coming out of abusive situations, I think that's super important.
As we move to the approval process and the funding process, the contract process, just want to say, which is possible. Guardrail and advocacy and other things to mention. So is this something we're thinking about provisionally moving to the next round? Is that a formal thumbs up or just yeah? And here it comes down. Neutrality, extensions. Oh, okay, we have a middle, trouble middle there.
It's not their focus, and so it's kind of like a side program, and that's why it's this. And they're already a great organization again, but are we trying to create, a new box and a new, that could be a great thing. Because they already have the infrastructure and everything kind of set up, and to add this component. That's why I'm kind of like.
So this might be an opportunity to get further clarification from Tessa and come back up. Because I think one of the questions is there a way to focus this funding on the oversight side of all the great work you're doing so that the council will feel comfortable just for the owl and sorry.
Susan had to go feed her meters.
Question I have is that there's a little concern about what we do, how we connect to making sure that this council mandate prevention of opioid is addressed, and is there a way for you to contract fees to do that? Is that operating?
And just to respond to your comment too about this sort of being like a side project of ours for the half and half. This is actually the school outreach piece has become a huge project of ours. And it's something that I have like my hat on because I have teams myself, and this is really important for me. We are schools educated, and because we are doing it less of like an assembly and more of really in smaller groups, we do see the outcomes from it. And again, what I kind of said at the beginning was that piece of the basis and knowing that kids are exposed to unhealthy relationships, domestic violence, kids have been privy to that in schools and teen dating violence relationships. We are seeing an increase of drug use, unhealthy behaviors, et cetera. So we can directly tie it to being able to see that if they have these factors present in their life, they're more likely to choose other unhealthy factors in their life, such as drug usage and going down that path. And so I feel very strongly that we try to quantify that, and we do see great success in our schools. I'm happy to debate that part, but we do see really great success, and it is becoming a really cornerstone playground for us. Is this prevention and outreach, because the ideal is that we don't see down the road. So this prevention piece for us is huge.
How big are the groups?
A big student that we do it. It really depends school to school, but we're talking max 30 kids usually, because we are in a small. One example is we're from Fountain to D38. And so Air Academy High School, we go in and we do takeovers of all their English classes for 2 days at a time. Actually, super cool side note, the way that the teachers tie it in is they use one of their novels of study, and they tie in unhealthy behaviors into the novel of study, and then we're able to come in and partner off of that and talk about those unhealthy behaviors. Those are classes that could be anywhere from 15 to 30, depending on if it's an honors class, et cetera. So we are really looking at smaller groups. So even when Susan indicated when we do those takeovers, like the really big takeover days, we've done that at Coronado High School with their freshmen. So we go in for their 2 freshman orientation days before the freshmen start school. We do a big kind of welcome at the assembly, and then it is all breakout groups there. So we are having more individualized touch points, and it's not just the talking head.
You include parents in that process.
So we do include parents. It's really difficult sometimes actually to get to one night. But we do parent evenings at the schools where they're able to come and see the education that the kids are having. It's a little bit hard to get them to come. but we do everything we can to incentivize. But we do offer those in most all the schools. We do offer parent evenings to them, come and have the education, because how else are they gonna go back and have this conversation around the table? Unless they've heard it too.
Do you send something home though,
We do.
or like, yes, the school do that?
Yes, they do,
know,
and so we do, yes, they do. And it is an opt-out, most schools do an opt-out form, so. So then they don't have to opt into it, so all the kids end up getting the education usually. So,
Um,
and that's the school choice, that's not.
I understand, that's the variations, very, that just, yes, but that was not our share. Is there anything, I mean, obviously parents have the right to opt out, pretty much everything. But is there anything that's controversial that you have found or objectionable that parents tend to look at?
No, because none of it is like, it's. None of it's where we would find more controversies in sex education and. None of that's included, that. So no, I'm really. Good to know. No.
Any further questions?
So post, like, so let's say you take over your academy and you do an education, how do you know whether that's effective?
So again, we do, all of the students take a pre-survey where they have to answer a slew of questions about just their understanding. And then the post survey that they do after it, they do fill out what their understanding level changed. And then it's not just yes, no, yes, no. I mean, there's open-ended questions. And their teachers are also oftentimes having them do an assignment related to this. And then they're having to show their teacher the outcomes, whether that be through a written paper. Again, that's on the teacher to do that. The teacher decides how to interact with us. But there's a lot of really cool ways that we've been able to see that feedback, and then the teachers provide that to us, and then we'll test the outcomes that they're having.
I was gonna say it's my third year doing this, and we have schools that call us back every year. And so I consider that to be, you know, they like us, they want us to be there, they're noticing something in their students. And I've heard from counselors and teachers and principals the same thing, so.
Did have a question, and that's more specific to Eric's and Chief's area and my area. What have you affected up at Teller County? Or what schools have you gone and spoke to at Teller County? And without bringing up political question, what's going on there?
Teller's a little difficult, but we are able to reach children through non-traditional ways in Miller County. So it isn't that we're just in the schools or in school-based organizations. We can do a program in the library up there as well during the summer. So any way that we can kind of plug in and reach kids in a different way, that might not be school-based. We've started to make a little bit more headway in our schools up there. But again, as you know, from that community, it has been a little bit of an uphill battle. So again, it's really looking at small traditional ways to be able to meet them. Youth groups we've gotten engaged with, or other sports, like sports groups that kids are involved in. So any of those ways where we have a captive audience of kiddos that we can speak to, do training with the coaches, so then be able to talk to them as well, and health behaviors, with all those opportunities. We do that same stuff down here, but we're seeing real.
Okay, how about RE1 Cripple Creek?
Or we've started to talk with Purple Creek too. Yeah.
Okay.
So all of our services extend in Creek, so all of our victims.
Right.
Creek too.
I was just curious, those services, how effective are they right now based on the climate that's up there right now? Because it's pretty difficult with our school board or the school system in general up in Teller, that trying to reach those students, it's pretty hard. And they don't have a whole lot to do up there, and that's a big concern that I have is youth up in Teller County specifically versus all the different things that are happening down here. It's not really happening up there, so I want to see programs expand, not just from Colorado Springs. They need to go into the rural areas, you know, even as far as Peyton and Falcon.
So we're all out in Eastern too. So we've been in Miami Yoder schools, we've been Hanover. So we are getting into rural communities again. Teller we've struggled with a little bit more. It's a challenge, but it's not a challenge we can't overcome. So,
okay. All right. Fair enough.
I don't say no very easily to them, so.
Thank you.
So,
Thank
so I continue to knock on their door.
Keep doing it.
Yeah, it's not really a question, but it's more of a comment, and it's more of a comment towards the education concerns within a school. And so I was a school resource officer when I first started for PD. 20 years ago, I was assigned to Harrison School District 2. So when we first did those programs. We did DARE, Project Alert, drug education programs within the school. No longer we do those programs. So my question, it's not really a question, it's a comment. PD's not doing those programs. Maybe a school might be doing a program, but if we don't have somebody else at least reaching out into the school, then who's doing that? So kudos to you all and to you all for doing those education components in the school, at least for Colorado Springs, we don't do those anymore. Totally agree with what they said as far as peer-to-peer communication, that's very influential, but being a person that taught those classes, I can tell you developing those relationships with those students were lasting relationships. I do believe that it had an impact. Anecdotally, I can't say what the impact was, but I do believe it had a very positive impact based on the relationships I was able to develop with students and the feedback I got personally from them. So I do think there is definitely value with at least there's different components to reach different audiences. Peer-to-peer is one. Some kids love peer-to-peer. Some kids might do parent-parent. You know, I was a mentor for Big Brothers Big Sisters. That's another program to maybe reach out to and get involved when it comes to teaching, mentorship, all that other stuff. But it's just more of the comment of, I believe, based on my own personal experience, there's a high value of education within the schools.
Well, and I think again, to your point, it is putting that adult in there. And we work, that isn't just their teacher that they see every day too. And the way that we work with our SROs, both through the sheriff's office and with your department as well, is creating that safe environment for the kids too, and having that partnership where they know that they have that person in their part. I don't think it's really like, so thank you for your time.
Thank you.
Thank you.
Not for these ladies, no, I do have a general, since we're talking about these ones, I wondered if, Matt has any comments. Being a person who has children who are affected, if there are any of these kind of even more generally that you have thoughts on that you feel like would have been beneficial?
I do, and I was raised my hand when you were talking, but sorry. James said, wait till the end. There's Yeah, so for those that don't know me, my name is Matt Riviere. I lost my 2 children to fentanyl poisoning in July of 21 here in Colorado Springs. So the comment I wanted to make, and I go into the schools and volunteer my time, but I work full time. So I don't get to do it a lot, but I go into Mitchell High School. I spend 2 days at Mitchell High School every semester in the smaller classes because I found that to be very effective, captive audience instead of big assemblies. But you know, to your point, I think it's so important to consider the parents. When my kids died, and the coroner called me, and they said, you know, we think it's a fentanyl overdose is the term they used. Do you know anything about it? And I didn't. And so I think it's so important as I think about my kids' journey and how they got to try, obviously what they thought. I wish I was a lot more educated. I didn't know about the high potency THC, and now Libya's educated me. She's an incredible woman. But it's so important that we do reach not only the kids in a lot of different ways, right? I love the peer, I love what Full Circle's doing, but to me, it's a multi-pronged approach. It's not a one-size-fits-all. We need to get into schools and smaller groups. We need community things for parents, and I found that I went down to Alamos for 4 days in Crete and Lake City and spoke to the schools there and to the communities. And that was a really great way to do it, to go to the schools during the day and then talk to the parents at night. Because everybody was on the same page. So the kids got to hear the message and the parents got to hear the message. So all that to be saying is that the marketing, I think, is important. I love what you guys are doing. I think a billboard, just my opinion, it's a conversation starter to me. Because I'm not going to get on TikTok and I'm not going to do those things. But I think as people drive and they see signage, whether it's a bus stop or a bench, what a great conversation starter. Hey, what do you think about that? And I think, you know, we're in our cars a lot. I think that's just another way to do it. So that's my opinion as an effective parent. And as I go in and talk to the kids, I do think that you know, I would love to do this more often, but to go in there and have a captive audience and talk to the kids about, I don't go in and I don't do drugs. That's not my approach.
but to really connect with those kids and talk about some of the other harms that you face, like the social media stuff, because it's all interrelated. And obviously we're seeing, you know, these harms come in these bad choices from a lot of this other stuff that these poor kids are struggling with. So is that helpful?
Yes.
Thanks.
You're welcome. Thanks, man.
I'm gonna keep going for some time. CASA, you can talk about there, we talked about, you know, right now, thoughts on CASA.
My only thought, and first, and I'm, you know, they always say where I stand for, tell where I sit, and one of the other ways, the way around. I give the CASA every month. So it's a monthly donation my wife and I make because we believe in CASA and what they do. You know, this doesn't necessarily expand their services per se, but when you hear about the CASA families and the CASA kids, they live in, this is where they live for most of them. You know, that special advocates and most of these kids, and maybe even Michael can speak to it as well, because I know they're intimately involved with CASA. You know, this supports the support of kids who, again, this is where they are. They're living in the opioid drug world for most of them, not all of them, for most of them. That's where they're coming out of, and that trauma that they're coming out of it. Anything we can do to help, even just helping to educate classes, the actual special advocates on this is money well spent, and it's not a huge ask. Even to add to it, other than I agree with everything you said, these kids are living in trauma-filled world all the time. So I agree.
I think that's awesome.
I think it's a lot of bang for the buck. I really do. It's like, because you think about, you know, GA can tell us what the cost is going to be down the road, and we can intervene for $2,000 kit and change their life trajectory. I think that's a lot of bang.
Other comments on CASA? So can I get an informal, I'm sorry, that all thumbs up? Okay, that's good. So we have unanimity on full circle program, unanimity on CASA, Pikes Peak. Tessa, we have a few tepids, the response exchange or tepids, or are you still the tepid? Thank you for jumping.
Maybe I'm a little more.
Okay. So close to unanimity on that, Tessa. Joint initiatives with youth and family. A little bit on that. I say sure. No surprise. Go down the ranking, we'll get over more of a debate, whether or not it should be funded, they would do it in. On joint initiatives.
I'd like to hear a comment. David made the comment earlier about how this was staff heavy. Wasn't this the one that council members are talking about?
Like initiative, you still roll, can you come back to the front and down the front of the question? File staff, tell you this, we'll go to that budget. So David, you want to? Let's ask a question.
Well, it's just a matter of, you know, when we look at different programs of bang for the buck, you know, we're seeing, well, with full circle, they have a pretty large volunteer type component, which lends itself to efficiency, but sometimes not professionalism. I know how volunteers work. So, but I love volunteers, okay? So with that, it just kind of seems like it's pretty heavily programmed. Personnel. It was an observation to point out 78% of this is gonna go to a salary. And that just seemed good to say.
Yeah, my response to that would be that the youth and families that we receive referrals for have extremely complex cases. We don't get easy cases with joint initiatives, and so we need staffing capacity to have deep connection and follow through with that youth, with that family, and with the community partners that are coming to the table. We ensure that everybody during this ISST process, the individual plan development process, if an organization says we can provide mentoring 2 hours a week, right? We ensure that they're doing that the youth are showing up. And if they're not, we're following up to see why. So it's intensive work that takes that human capacity. Also really a lot of trust building work, which takes time and relationship building.
Any additional questions or comments? Any additional questions or comments?
please.
Yeah, so that makes sense to me because it's very service focused. But I'm still going back to the connection here. How long have you guys been running this program?
So we have been running the ISST program for well over 10 years.
So in those 10 years, going back to who you are currently serving, how many of them are currently dealing with opioid or just generally substance use of the folks that you are dealing with on this line?
Substance use at least 50%.
Okay, so 50%, and then on follow-up over those 10 years, how have you determined if they are continuing to use substances? What does that follow-up look like of those 50%? What stats can you give me to show that you've already had success since you've been around for so long?
Yeah, so we are tracking outcomes during the time that we're working with that youth and family. And so our drug-related outcomes are that we're having less than 10% of the youth who we're working with drug-related issues using again during our time with them.
During your time with them, which is how long did you have? And I know you said you're working on longitudinal.
Yeah.
Longitudinal.
Yes.
I can't talk today. But so, and how long is that period of time that you were currently measuring?
See, it's typical for youth who are using drugs to be on the longer end of the spectrum, so it's about a year.
In fairness, I think that we have to know that it's tough to do longitudinal, especially around mental health and substance, given, privacy guidelines, unless the youth were to sign up and say, you can track my data for the long term. We just can't. We have to keep them within a program to be able to do that. So longitudinal is tough.
It is, yeah.
Although it'd be great to have.
Yeah.
So you guys are headquartered out of Galileo, right? So and you're wanting to serve more youth and more families, and again revolving around that and looking at you're hoping to serve 300 more youth through that. What does that outreach look like? Is it regionally to that location because that's where you are? How do you see your growth of services, your growth of connection, and obviously probably not going to reach up to Teller County, which is okay, not everything can. I know it says that you're targeting them up to there, but
yeah,
it's a long way from Galileo Middle School to Crockery.
Right, absolutely. So our work is defined as the 4th Judicial District. That's who we're looking to serve. We chose Galileo because of its fairly centralized location here, but also they are implementing a community school model and have a population that really needs those services. So it was kind of a win-win in the moment that we were looking for space. So, and unfortunately, we have had 2 instances of drug overdose. Didn't result in death, thankfully, but within that building since we've been there since November. So we're in a high needs area of town, but open to the entire 4th Judicial District. And our outreach, since we have the REACH committee of all of these different organizations, they are kind of our arms out to the community. And so we receive referrals from school districts, the court system, right? And all sorts of utility organizations.
So I have a few clarifications here. One is, so your footprint is much bigger than Galileo, correct?
Absolutely.
So it's like citywide or countywide?
It is. Yeah, it's actually larger than our.
Because that is a space you can use, okay.
Yeah.
Can you go back to the budget side, please? So a couple of questions. So you have a massive amount, I don't know what your total is for your organization, but you have a number of very large grants into the millions. And so and coming for a growth of this piece of it. I guess, this gets in the weeds a little bit, but what is the contractual for tutoring and school stipends, and why did you add a de minimis on there when you really have a very large organization that can probably fund all of there as part of that anyway?
So the contractual for tutoring, we have an organization, Success for Life, that focuses on tutoring students who who were really struggling in school. So we knew that we wanted that contract to continue. We've started utilizing their services before school, and would like to see that expand. And the indirect rate, I think that's something that we would be willing to discuss and contract process. But it does take funding, you know, that indirect piece to be able to cover administrative costs. So it's just kind of typical that we would put that in there, but definitely up for discussion. I also want to throw out there that we do work in the early childhood space as well. There's two very distinct buckets of work under the Joint Initiatives organization. And so that budget is reflective of early childhood funding and youth programming as well.
So, I can take what I've been just mentioning. Any further thoughts on this one? Here's a suggestion. It seems like we have unanimity on Full Circle, Tessa, and Casa P. It seems like we have further discussion on joint initiatives, even if one chance to grow. I recommend that.
Hold on. I might disagree. We had some great debate about one chance.
Yeah, I don't agree with that assessment.
So I retract that. One chance to grow, we can talk about right now. Like where I was going is that we have an opportunity to look at all the other funds. And look at this intentionally, though. So if one chance to grow is one that we fully agree with now, we take it out of that bucket and put it in the bucket and fully agree with just full silver, Tessa and Casa. Further discussion on one chance to grow.
We discussed it a ton. My opinion is it's something we need to support pass through. That's the.
I agree.
And I know, it seemed like we were like moth to a flame about billboard, but that wasn't. Something that makes sense. I'm a marketing guy. There are lots of different pieces, everything from Snapchat to billboards. Let's not get locked onto that. That's for those people who get paid a lot of money to do marketing and advertising to figure out who the market is and how to reach.
Yeah, it's Dave's fault.
They had time on it, was a line on it. Literally a line on the budget, it says billboard. If it would have said TikTok instead of billboard,
It's and.
it did not say TikTok, it said an old guy attracted.
Try.
What's it? What?
Honestly, maybe it's a lot of mails and make sure that social media.
Yeah, I would love for them to partner with Full Circle and get a marketing perspective of what they think that they want.
Honestly, I think we pull that full circle, work with them on their focus groups.
We agree.
Yeah.
We have something in the stand and these definitely meetings with well, so.
So it sounds like in the contract potentially have there, to ensuring around social media and ensuring that the focus groups are informed by you, not just the tops of the tops.
I think they already do that, but
We can buy one billboard by line.
one.
One line 25.
I think it's informal thumbs up on one chance to grow. Any tepidness or thumbs down. Right, then let's talk about the joint initiatives for youth and family, just to level set, can I get a full thumbs up on them?
Yeah, I have a comment, maybe.
Yeah, go ahead.
So I'm struggling. While I think that there's a lot of good things that are happening, there are a lot of great things out there, and the question to me is the fit with the funding that we have here. And some of the things that they're doing, I understand prevention being very upstream, but some of them seem, tutoring and all those other things seems way more in the education realm. Struggling a little bit of that, being someone who has started a charter school and loves and knows how important all those things is. My school funds all of that stuff, and so I'm really struggling with whether this is the appropriate funding stream for all of the things that they're doing. Hearing that you have students who are struggling with substance use, again, I can kind of see that, but it's definitely a wider program that I'm struggling to make fit into this box to the same extent, unless we could carve some things out. I'm just struggling with it, but I'm not a hard, fast no. I could be convinced if someone has some great comments.
So a couple ways, lots of ways to do this, we absolutely will help me. And so one suggestion would be that given that we don't have a hard no here, what we have is we're still thinking about it. So one thing we might be willing to do is advance the four that we are interested in, even if it's funded. We continue to consider this one in light of, so it gives a chance to form an intention of the good programs that might come up.
Can you pull the budget back up, please?
And a budget to meet.
We've done that before.
We have.
So we could say they're asking for 295, we'll award you 200, we wanna take 95 and put it somewhere else. We could do that, right? We can reduce their budget. Okay.
We could, and there's certain parts of this, I completely agree with Carrie that, you know, for tutoring and all that, and I agree, also with comments about the minimums, you have a fairly large organization coming in, it's like, that's almost like your match, in a way. So yeah, we'll run this because we exist, so, you know, those two right there I have issues with. And I don't have any issues really with supplies and materials, but matching up the people, you know, all this personnel with outcome, I'm not making a connection there. A clear connection. I'm not saying that they're not doing the work, they are, that this maybe wouldn't help expand into, you know, what that work isn't, but I don't have a clear in my mind of for a $230,000 investment in people of what that outcome, what's the measurable outcome on that? What does it look like? And part of that, you know, could be just, you know, what we've worked with and what we've seen. But going back a year ago, where we started with this, we were really disappointed we didn't see a lot of stuff that we thought would be effective within this bucket. And now we're much better. We're in a better place. We've got a lot of things that we all agree with. That's where my struggle is that are we gonna get, you know, that return on investment in a way that's gonna move the needle, because it's a pretty big ask. It's the biggest ask we have overall from this whole group. I talked for 2 minutes, I'm not sure I actually said anything. So
Look, I can keep going on this, so I recommend that we kind of pause in this section. And then keep going and then come back to this, so a lot of strategic planning, what do we do with the remaining? Is that recommendation accepted? Please.
I would like to add, you know, maybe ask the group to come back to tell us exactly what each one of those positions is and what they'll be doing at a later meeting. That way we have an understanding if we do need to cut costs somewhere, it would be one of those personnel positions we wouldn't necessarily need, or we want to see a larger scope of work. I think that would be a better way to spend our money at this point, is figuring out what assets are more important as far as personnel versus, okay, is this person just, you know, or what are they doing? What's their job?
So at this point, we're gonna move to the next section of the agenda. Thank you for that comment. The next up is on the agenda here, we have the MOUD applicant follow-up presentation. Crossroads Turning Point. I know you're in the room. Thanks for your patience in coming. As you recall, they presented with the MOU section speaking, and they actually brings down the master development to get more data. The data they have is years. And so it's advanced, we had conversations. Now he's here to really answer some of the prior questions that came up around data, source of data. So with that, you can unpack the slide and maybe open it up to Q&A.
Yeah, sure. So I'm Dr. Archuleta from Crossroads Turning Points.
I'm Alice Kramer, I'm the Director of Withdrawal Management and Education Treatment Services.
So we came in, we talked about what we do, withdrawal management services. We're the only detox even kind of in this area, which is what withdrawal management is. What we're talking about is serving this community. What we would like to do is, just a quick reminder, is we'd like to provide opioid treatment in the form of medications in our withdrawal management. So here's the numbers of like the referrals. referred to, I know that was a question where we referred to, where were the referral sources? This is just a snapshot of the numbers, that our CEO and our executive team kind of came up with to share. We had loads and loads of data, but this is kind of the data that Diversis wouldn't have or that the state wouldn't have that's not public information. And so for us, just since the last meeting, we've had 83 people come in that could have received services in the meantime. And so what we're doing is we already have the patients there. We already checked that box. We're talking about treating opioid addiction, and we're talking about treating them right there. And hopefully that takes the burden off some of the hospitals, because the hospitals will feel the burden of the people that are in bad shape that end up going back on the street or that ended up having to go back to search for medications. So is there questions on the numbers? I know that referred to, what do they do after they leave us? What do they do after they leave withdrawal management? We always try to refer, it doesn't mean they go there. Can't guarantee that we could make them go there, but nobody leaves without a refer to somewhere.
And within the last year, we actually did get a total of like 444 patients into sober living. So giving them that chance to kind of rebuild their lives once they were sober, leaving withdrawal management. So those numbers aren't reflected on here because those are numbers from divergence.
I think the big thing for us is at withdrawal management, that could be a quick walking. What we're trying to do is we're trying to slow the motion of that door. We're trying to provide services. We're trying to connect them to the community. Like I said before, if you look at Maslow's hierarchy of needs, people doing fentanyl, people doing opioids, their basic needs, not food and water, it's more opioids. This takes care of that need, getting them the medications that they need in the form of Suboxone, Vivitrol, Subutex, long-lasting injectables. If we could get them on those medications, then hopefully they can start to look at other things in their lives that they want to straighten up. And when they're in withdrawal management and they're coming down and they're withdrawing and they're starting to feel better, that is when to get them. Because the minute they walk out the door, like, I'm not going to the clinic if I could feel better down the street. And so we're trying to offer the clinic in withdrawal management so that there's no barrier. We're eliminating the barrier to get those that are in that contemplative stage and wanting medication, get it before they walk out the door.
So I have several questions. First, can you define when you say refer to community? What's community?
So community could be anywhere from like, it could be TPU, it could be hospital, it could be well, medical is back to the hospital. Community could be back to probation. Well, that's correct. So community, everything else.
Doesn't refer to us a lot, and they also want to follow up with their patients once they're sober because they can't really provide the services that their patients need when they're intoxicated. So they do refer a lot to us, and then we also send back they're sober.
The other thing the community is the 12-step groups, AA, NA. Saw somebody from the Phoenix. So that could be community groups. And then the rest, sorry, I can't see it from the side, but
I would say most of those numbers are diverse also.
Got it. All right. As far as when you say Matt, put on an MOEG, 16 referred to, does that mean you gave Matt treatment to 16?
no, that's
You referred them
we
to.
referred out, right? And that's what we're trying to do it in withdrawal management. Right. That's what we're trying.
We're trying to do more of that. So we used to use other partners. We don't.
So I'll just be honest, because now Alice is gonna be really political and I'm just gonna straight up.
Great.
So what this number is a partnership. It's the tail end of a partnership that we had with another organization that was coming in and providing Matt services via telehealth. And then it got to the point where they were having trouble keeping a provider. So they were having Zoom providers, they were having providers all over the place. They didn't understand that we're at 3.2 withdrawal management. They started prescribing withdrawal medications. We had to put a stop to that because that would kick us up to a 3.7 level of care, which is medically managed, which we are not. So it got to the point where they just faded away.
We tried to refer to other MAT services as well. It just kind of depends on the area that the patient was returning to and where they could make it work.
Yeah, but that is the tail end of what.
Okay. And I know that you sometimes Tormat from the fire department is coming there, right?
Yes,
Where
that
would that
would
fall?
include any of these numbers, because this is through December.
Student center, okay, got it.
Yes, and right now we are utilizing your map.
Because I just like to state that I think that you are the perfect place to be able to start. Okay, because you have the people that are going there to go through that process. And the best way to get them through that process is to give them that treatment. And so right now, I know you do have a relationship with the fire department where you call in the tour map team. Not that I want those numbers to go down,
Right.
because it's the fire department, oh, yeah, right? Yeah,
This morning.
oh, yeah, exactly. So that's a great relationship and everything, but I will say, I believe that you would be the perfect place to be doing that. And because it's completely medically sound. There's no concern for anything.
Well, the patient's there so we can monitor stabilization.
Plus, we're minimizing withdrawal symptoms.
Right.
Like, they're needlessly suffering right now.
Yep.
Which is why, like I said, which is why that shows you our dedication to saving them, is we brought another agency in to do it for us.
Yeah.
And so, you know, that didn't work out, so what we're thinking is if we can get our own, we're not gonna miss out on you, there's enough people. Like, we gotta provide us a couple times.
Yeah, after the last meeting, when there were concerns, I approached Alice and I approached our team and said, can we go help in the interim? Because I believe in this should happen. It is the perfect place for it to happen. That's where they feel the worst, so we're kind of like helping in the moment. But I think this is something that, and I think it gives us a chance to say it works, right? Alice can testify to the team coming in when people are starting to feel horrible. And then get that treatment and feel so much better, and then it helps them get started again.
And it doesn't make them leave, it just kind
It keeps them
of
from
minimizes
leaving,
their
probably.
extreme symptoms. So, yeah, it does keep them there.
Otherwise,
because
they wanna
they're-
go get high because they're so miserable.
Well, I'll tell you, total transparency, I've lived experience, you know that, some of you that know that. And this is, I always say I was like an anthropologist, I did ethnography work with addiction out in the field of the streets. And so that's how I got my PhD, but what I would say is, just the honest to God truth is, if I have to go to a place, make an appointment, call, fill out paperwork, even if it's just my name and number, why would I do that once I'm out the door, when I could walk to under a bridge and feel better like that?
Yeah.
Why would I do that? I won't do that. You have to have strong supports and family supports to get you to there, which fortunately I had, that not everybody has. So what we're trying to do is we're trying to say, like, let's eliminate as many barriers as we can, adding your team to what we do, and adding hopefully a new provider. And this isn't gonna be, this is in by no way an easy lift. We're doing it in Pueblo, and it is complicated. It is complicated to make sure everybody's medically sound. It's complicated to find doctors that understand mat services, that are gonna be willing to give people withdrawing, people that are on fentanyl, these medications. And so this isn't gonna, you know, it's not gonna be a cakewalk. It's gonna be an uphill.
And I don't think you have to wait for my team to show up. When my team works 4 days a week, 10 hours a day, that leaves the other days, the person that can be there to identify it. It makes so much sense.
And I think that you're key in saying, barrier elimination, okay, which is so huge, and I think that a lot of people don't quite understand the significance of that. What's one person would not even consider a barrier at all are huge barriers to, loads of this population. Even getting to someplace or handing them a phone number and they have to make a call, that's a barrier. All these things are barriers. And so being able to do that on the spot and making sure that there are no barriers is perfect. And so I would fully support this. This is I think that MOUD is sort of the raw direct connection to what we're doing in this committee. It's like there's some things where we're saying, okay, we can see this is upstream, this is whatever. This is more of a rescue, right? I'm not putting down upstream, but I'm saying this is a direct connection, something that really can make a difference. You're the appropriate place to be doing that, and so I'm happy that you're
Thank you. It's a widespread kind of support organization. Last meeting, they were asked to come back today. because of some of the data. It's a reminder their funding request for 242,550. I think the thought was they would talk about data and then it might be advanced. So I turned to this group with further questions, or if they're willing to give us a thumbs up. Sign some thumbs up. Any just tepidness or any thumbs down? Seeing maybe feeling something. It seems like it's the to get out of this road. And we gotta move forward with your end. So I'll be in touch with all those that are advanced in terms of next steps and contracts. Thank you for your time. Thanks, Conrad.
Hey, James, just real quick. We are way over our schedule, so let's try to keep our comments concise and to on point.
Thank you. Thank you. That's why I need to try to push. Okay, next up, is the Colorado Rise and Run. So David, Colorado, connected in the back. We're not sure because this is the time. You were previously here to which is why we're seeing again. And the reason was, I think what you're sensing from this group is the importance of ensuring that the messaging that this group pays for is aligned with the message they want in the community. So there's future dialogue, I'm going to suggest that we have a subcommittee that talks about messaging, and they realize we have all different unite all themselves and others here, but we do have an opportunity to look at the messaging. We also need to make sure that we have another arc coming down on high concentration cannabis, a lot of messaging coming from that. So I'll ask for a subcommittee, we'll talk about that next. But for now, we'll turn it over to you folks to try and then take the way for a while, but as much as possible, you can reduce the slides, them, to connect with that. Yeah, how long would you like us to take? If you could go 6 minutes, that'd be perfect. Thank you. Thank you.
Yeah. Hi. My first time presenting in front of this group. My name is Jenna Garrow. I'm the director of prevention at Rise Above Colorado, and I'm happy to be here to just update y'all on progress.
I'm Eric Anderson with SE2. To James's point, actually, in one of the other regions, it's common to have work for this stuff, so I think it's really well. They should forward, but instead work on it. So it's not a long time to go. So I'm a marketing guy, but I'm a behavior change marketing guy. And so this is a campaign that includes marketing and community engagement to go upstream as soon as specifically. We know that the highest ROI for spending is going upstream. The other elements are super important, but if we can stop kids from experimenting with drugs or pills in the first place, we can avoid a lot of problems down the line. I also wanted to say that I have the privilege of working with One Chance, so be extra sure that it's alive. So what we've done here, as you may recall, is adapted the statewide connected care campaign funded by the Colorado Department of Law, and adapted it specifically to El Paso and Teller counties. And the idea is to take the best of that and then make it localized with real pictures, input from teens and focus groups from teens to make sure that our messages are hitting them where they live and that they feel that it resonates with them. So these are just two examples of how the statewide Connect effect has been adapted to Teller County and El Paso on the left. These are local statistics based on survey samples from their communities, and these are pictures of stock photo sheets of teens in those communities. So it's not El Paso kids in Teller County, it's El Paso kids in El Paso, Teller, and Teller County. And we obviously are keenly aware how Teller County and El Paso County still are the same region, are distinct and think of themselves as very distinct. So we're using the social norms approach, which doesn't look very good, but
I think we maybe should skip this for the sake of time. Just a big reminder that social norm campaigns is an evidence-based approach to prevention. And it's what the statewide Connect Effect campaign that has performed really well is based off of. And so I'd love to just catch us up to what has happened in the field with the youth discussion groups and get into the messages that we love your feedback.
Yep. I do want to say that social norms approach is we consulted with and followed the advice of ADAPT, and I don't know if any of you are going to their Colorado Springs Summit next month.
So hold hands. They are the gold standard for this. They are the prevention arm, as you may know, the HIDAs around the nation. That they work with the law enforcement folks who are doing this hard work every day, as well as the EPA, making this prevention, and they have concluded that it works, and the more local data, the better, which is why we're using it.
Yeah. And so over the past 8 weeks, we've held 3 distinct youth focus groups, 2 in El Paso County and 1 in Teller County. And there we had just a collection of youth aged 13 to 18 within our target demographic. And we were able to share data as well as these messages with them. And that was the focus, was to get their honest, on the spot reactions to the messages and really see what resonated for them personally, as well as for peers in their grade level, their closest group of friends, etc. We also just had the opportunity to learn from them what is top of mind and most relevant to this from their own perspective or the purview of their closest friends. And yeah, it was super compelling. And we've landed on some sets of messages that we'd love to share with y'all.
So they're divided by Teller County and El Paso. There's largely overlapping. And the key thing I think on this issue is because of the lethality, we need to balance the positive social norms approach while stressing the urgency of the risk. And that's what we've done. Statewide campaign. That's what ADAPT recommends, and that's what we've done with this. So the first equivalents are specifically seen on the risk. So we're not minimizing the risk. This is not something you mess around with. Obviously, it can be a lethal mistake for a kid that gets a prescription pill. And then we transition to the survey results, which show that in this case, 70% of Teller County teens think they can help those bottom line on the street presents a great risk, shows that majority of views. And then this is the bystander behavior in the second to last bullet, that they 78% of Teller County teens would encourage a friend to stop, prescription drugs, excuse me. So this is the connect effect. This is looking at our friends, acting with each other, and then 88.5% of Colorado youth choose healthy and no stress and negativity instead of substances. Next slide, please. Again, very similar. I think the first 3 would be identical, and then we just have El Paso County data next year. 86% of El Paso County teens would encourage a friend to stop misusing prescription drugs. And you may wonder why we don't have the number for, I think it's a great risk in El Paso County. It's actually because the number was somewhat lower, over 50%, somewhat lower, and the focus groups, the kids said, it doesn't sound like a lot, really. So we just took that one out. And then the same statistic at the last bullet there. Next slide, please.
Can I ask a question? You said whether taking a prescription, or sorry, taking a pill, what was the exact language there?
Presents a great risk.
Was it then acquired online or off the street?
Yeah.
Yes.
Yep.
Not really exactly. It's actually telling in of itself.
It's there, but what they're saying is even though it's loaded to be accurate, it's now, right?
Yeah.
They
Find it compelling.
didn't think it was that compelling. I'm just trying to look up the number. Let's say it's 60%. I'm not sure somewhere in there. They were like, oh, well, 60%. I think that's great because they were the it just wasn't compelling then without.
There's an area we can work on in another way, because obviously that's a concern. Definitely.
Increasing exception of harm is whatever. Yeah. Absolutely. So in terms of reach, because we're trying to reach you, primarily TikTok. That's why you don't have 58 girls talking about it. TikTok, Snapchat, online video, YouTube, that's where they live, right? And a little bit about it. It's just a conversation starter, and to get the parents engaged, because our campaign, the websites include information someone was talking about. Make sure the parents know how to discuss these issues with kids and start those conversations. So impressions for those who are in our business means sets of eyeballs, So in El Paso County, for the budget that we have almost 8 million impressions. And 3.2 or 3.3 million in Keller County. But the important thing is how many people engage with it, right? It's not just see it go by. And I just, while we were talking, I just looked up with our office and our click-through rate, for example, for top on the negative is just over 2%, which means that 2% of those who saw that to click through to the website to get that information, which is, for those who don't know, the latter.
That's what it's like. It's like 1997 numbers.
That was the height of it, right?
Yeah,
That's what I'm below that, right? So we know that campaign performs well based on the other regions of the state, but we're adapting it and we'll be we're approval of the messages. We can get going. It's not really gonna be 6/1, it's gonna be more like mid-June before we're actually live. And set up the websites. The websites will just be online right now. It'll be a localized version of the Connect Effect CO youth page, just the state one, just mixed in with local data points and a few things updated to reflect the latest research. That's all we have. How do we do? Yeah, great. Questions for the group. Again, this is just an opportunity for them to further highlight what's coming out of the pipe. My recommendation is we do have a subcommittee that monitors messaging that comes out of this and the fledgling messaging that's gonna come out of the high concentration cannabis RFP that's coming up. So with that recommendation, are they clear to continue? And then we'll talk separately about should we develop that subcommittee or what other oversight the subcommittee wants. Right. And James, just to be clear, if that's your decision, you will see this campaign again or in the field before you have another. So it will be based on all the best practices, it will be based on the statewide campaign, but we won't ask for permission again before. Question. Okay, take thumbs up. Anybody tap it or thumbs down or curious? Seeing none. Okay, well, thank you for your time.
Yes, thank you so much for having me.
Thanks for you all serving on the. So a little behind schedule, I got an idea about the rules for that. So the next 2 days on the agenda for strategic planning. So I wanted to talk about 2 different sections in this area. One is planning for the remaining grant applicants. The second one is a high concentration marijuana and opioid use disorder. Let's start with that one. Is Becky Shafty? Okay, yeah, maybe I can come up. So we developed this RFP, as you recall, that has to this council. And the RFP was in a different mechanism than what this process is. That mechanism was driven by Becky Shafty and Amanda in the background. It's through the bid process that to hear you ready to come up here. You can sit in the seat too. You can sit on the seat. And so the way this is structured, the way they've done that, normally they do this as a project, what do you call it, a project expert supporting you. Yeah, on this one. And the question is, for this group, is the best way to handle this to go to a subcommittee to review it. I'm gonna let Becky speak, but one thing, if this group even wants to talk about it, is we have new disclosure forms to sign before I show you any of the RFPs. I've read them all already, I've explored them all already, like this already. The next step is being taken into the subcommittee to review and then deciding which ones we want the full group to interview. So with that, I'll turn it over.
Yeah, just to reiterate what James has said, all the submissions are in. So I just need to know kind of evaluating those, and then we can release the non-disclosure form, which just says you don't have any personal financial gain from anyone who has submitted. If you do, then you'd have to, step down as an evaluator for that. If not, then we'd release the submissions. When we have some evaluation criteria that we've outlined, we have score sheets and everything available. So really just what I need from the committee is who's going to evaluate. And then that would either shortlist or determine who then we're bring them to interview.
Oh, here.
So Marcus, any other?
I just need a minimum of 3, whoever wants to, but I need a minimum.
So that you want clarification for me, these 3 would vet them closely, they would then ask that interviews, they could do them on their own, or they could do it in front of the student. Point it gets to this group, and everyone still need to sign this,
If they're going to review any of the submitted documentation.
okay, so. So the way it would work is that offline, the people that have, accepted the challenge. Review these materials that we decide this, send it to back to the police, and box. And then we review this, we bring it back to this for recommendations.
Larry has four. In case somebody's not there, you still have three.
That's great.
Like it's like.
I just want to point out that I'm sending this and saying that I don't have any interest, but I have no idea who.
Right, so typically when we're with this, you would see who submitted, verify you have conflict in this and the. So I'm okay with once, yeah, sharing it first, and then you can just send that back to James or I. Okay, once you see, cause it's a. Don't, yeah,
That's right. So this moves us into a night off the table, and that decide how I want to share their voting, their educators alike with this group of you. And they close to these and decide if further disclosures are needed to be signed out.
Just say if there are recommendations for bringing people in for interviews, they've got to run through James and I to coordinate and communicate directly with those submissions.
And then just for the record, I found this out from the lawyer, I don't see the room today, he was over there, okay, yeah, so that would be, that would be a public meeting, because it's for those council members, so we have to, let's get them open it up, or that. Different.
Oh. It was Lynette, Carrie, Eric, and Jay, so no.
From State Farm.
That's good.
So we can take that offline, yeah, let's see, how it's on it. Okay.
He just has that publication, so that.
So that's, all right. Right, the next agenda item. The next agenda item, I really final agenda item before the next meetings are the goal for the next meeting. So I think we achieved a lot today. Here's how we have been scoring these battles. We've been scoring on the same sheet you have. We have a little handy zippy handout on each of them. And then we did that little math, even though it's a 100-point scale, when you do the math times the scoring weight, so 5 times 30, we got 150 for that section, in total 500. So this is how everyone was scored. As we move forward to the last two sections, what we are recommending is that we interview those that were 400 and up, and then we don't interview this time around, that were 400 and low. So what that would mean, we keep going to the feedback, is that in this section, it would be the top 3 out of 5. We have a total of 21 left. We now just let's start with it again. Now we're kind of fast tracking a little bit. That would also be the benefit of this group is that in June, rather than just looking at one section, we could combine the top ranked ones from both the SOW recovery support transition and the community extension, so we can actually start getting money out the door in different buckets. And then we come back in July and we can review the final ones that were 400. Keep going before I come back. The whole model only makes sense if we agree that those to the right and that those would not, that those that make sense, and that those to the right, we would be thinking about talking about maybe applying again in the future. So I'll open it up for comment. Carrie, there's a lot.
Yeah, I know, I was going to say, but yeah, I'm not comfortable with that. I'm gonna tell you why. So for example, 110 was scored the lowest in the last group, and I thought they should have been the highest. Confident yet in that scoring rubric to say that I'm willing to make those decisions, because I can tell you, I see some things already that I would have questions about. You know, the rubric doesn't catch everything that we've talked about, so I just don't feel. So I think maybe, and I get it, we don't want to hear necessarily all presentations, but I guess maybe there's something that we could go through and say, hey, we're gonna do everyone above 400, and then let's give an opportunity for the group to see them all and go, hey, on your own time, review them. If you feel like there needs to be one that needs to be pulled up, let's do that. Would be my suggestion, because I just don't feel confident yet enough in that scoring rubric that it's hitting the mark.
So, and on to that, it's not even the price. I mean, the tag on there, it's not 400 and up. I think if the program is really, really worth it, I'm not looking at that.
I'm not looking at that dollar first, you're looking at the impact to the community. So I completely agree. I don't like to see it based on cost.
So interviewing other regions, how they handle it, and because they're running into the same problem, right? Word's out, money's out, people are flooding with applications. So one region doesn't even accept applications until they give a letter of intent. And then they'll say, hey, what do you think? They're applying for like a many application. And then they say whether or not they're ready to interview. Other regions don't interview everyone. I think the first time around, we interviewed everyone, and that was a challenge. I went to marathon meetings. We're getting to the point where we might not interview everyone. What I'm hearing from this group is we're not there yet. We still want to hear from as many people as possible. So keep going, and then at the end, we'll make a decision if some of these groups should be precluded or not. Let me give you an example of some of the groups that might be precluded. So we have CDC Analytics at the bottom, great group. I talked to them yesterday. They are out of Canada, and they measure wastewater treatment to determine opioid. Seems like it might be something, they don't have a client in the US yet. Seems like it might be something that in the future could be interesting. So talk with natural wise, the chemist and a PhD, they can actually tie it to a direct school visit. But you can see what that school wastewater treatment. So just study it further. What comes out of the body is a good measure to determine opioid use that way. So the convention wants to be from time to time, it's a deep conversation. But these are the ones that I'm just saying. We're not ready to. The reason I'm bringing all this up is that might be one of saying we're not ready to interview yet. So I can come back with a non-interview list based on some of these type of questions, comments, and smiles and chuckles.
I was gonna say, I think that's actually fascinating and maybe one of the best measures that we could have. So actually, I think that's really.
Yeah.
But close, because you're looking, how do we know if any of the things that we're doing are effective? That could be an objective measurement that we can go, today we have this, we paid for all of these different things in our community. This is an objective measurement we can point to on whether things are actually working or not.
It's essentially taking a temperature.
Yeah.
I don't know that I would elevate it above at this stage.
No, but
It's interesting.
baseline is an interesting place to begin though. To say, it's very interesting.
You're gonna have to have a baseline you can control.
Because there's another component to that though too, is we have a public utility that might do a cost sharing.
So sounds like this could be a future one. I thought they were a little early. They also don't have one client in the US yet, so we'd be taking a chance, but they gotta start something, right? And so the broader point, however, is do we agree with trying to have the following groups present in the GP?
So the one thing I would say about that's a lot of presentations in one meeting. And if that's what we're gonna do, then I think we need to have nothing else on there.
I agree. So we can move away from the community ed presentations, away from any other prior warnings and only go through this. The model of 15. Then it would allow, 1, 2, 3, 4, 5, 6, 7, 8, 2 hours. One other caveat, I do suggest we might throw one more in just because of timing. What I'm getting concerns about in the background, some of the community members are, hey, we are, our cycle's coming up, we need to know, or we're at risk of layoff. So I might want in the background add and do one more with that. And I already took into account those conversations I've been having in the background, because some of them previously funded and accounting on this potential funding.
So even that though, if we anticipate 15 minutes for each one, the reality is there's gonna be some that go over that. Most of them will go over that, and that's gonna push our 3-hour time for the meeting.
Seemed pretty good today. The discussion was the.
Well, you've got to count the discussion. Yes. We can't just sit here and be blank facing. We've got to be discussing.
Could you go back to where balance or?
Yeah, let's talk about that.
But how?
It's just make the recommendations to line. It's
We're gonna go, Holly, 20 on the fourth spot for our chief. And we're.
Let's have
Excited about, I'm sorry.
So again, after what Carrie was saying, the model is still in refinement. It only stores what you're looking at based on these 5 little measures, alignment to school. Many other factors that can be thought through.
One, without knowing what's in these, because we don't, is, only one of these that I'm seeing up there that I'm aware of at least, is directly impactful to Teller County and happens to have scored the next highest on the list, which is UPenn's Regional Health Service. I kind of like, could you just send me that? Yeah, I'd like to look at it, and because I don't know what their ask is.
Yeah.
But I do know they have an active community paramedic program with Matt MOUD.
But again, I don't know what they're asking here.
This goes back to the comment that it's more than just the numbers, that's another factor, Charlotte County, El Paso, and how the funding is allocated.
Yeah, and I can say like Step Springs, for example, they're very good. A highly effective organization in Denver. They have a lot of proven results. And we don't really have anything quite like that at all here, and they are opening a new facility, so I really would be interested in seeing theirs.
Well, the next chapter actually has outcomes. Yeah, I mean, they actually have outcomes, which is what we're looking for, so.
Let's see how it passes chapter. Yes, see how it goes.
And I will still say, I really enjoyed hearing from the police and fire departments.
I can give a 30-second snippet of what I'm asking.
Yeah, I know that how often, of course, I live in an older neighborhood, one of the young ones. My whoever would put in great in my neighborhood, it's regular fire engines in our neighborhood. But it's old, it's older people, it's not, I don't think it's abuse. It's scary.
We get to pass the mark here, we support of me asking these groups to come to present next month, or should I pull anything out and replace it?
Well, even if we have to have longer meetings, because now we're pushed down the road a whole month. I think we build in the time to do it and just don't have any more community stuff, because, I mean, we're behind now. Which is very frustrating for me and the community, but it is what it is, so I'm willing to add another hour on to get through these so that we get the money out the door. I'm willing to do that.
Kind of an hour on the front end, obviously.
Yeah, oh, yeah, of course. But I'm willing to do that. No, I'm with you. Bring us down.
I agree with that. What do you mean by cutting out the community stuff?
I'm just not cutting out, I just think no presentation, it's just granting.
Yeah, I'm with you on that.
Yeah, that's great. I just mean that the way it sounded.
I know you didn't, that's why I wanted you to.
So this would still be pretty ambitious for the next meeting, and it would allow us, I had a less ambitious for July, it would allow us to see if that worked. And then I added others on July, and if we have more time, I can even go further, but it's a lot to get. So what are your thoughts? I think that's still to what these 8 to 9 at next meeting.
Yeah, yes, and I would say let's start at 1:30.
Okay. And they can keep at 6.
Well, I think let's shoot for 5, and then if we go over, we go over.
And Michael has to provide dinner.
And we were gonna go and catch this expand at some point, we want.
It's not sure I can get out of this chair right now.
It's your own guys.
We have the question, is that coming, please?
Hi, I just have a question related to.
Please, just so the thing is, we can't run it.
Can I sit down?
Yeah.
I just wanted to clarify, because we are delayed by 1 month. And our contracts, we propose a 12-month engagement of services, which expires June 30th. And if we are able to have a presentation next month, that would be great. But if there's that possibility that you want to hear from 7 more organizations, or you're not sure, is that going to push a decision from this group to July or to August, so that I can plan, how I'm going to use contingency funding to determine if we get a renewal contract from this group. So a little bit more clarity on what you're going to do with the whole statement of work number 4 would be helpful.
I think that's fair to say that it would get bumped, because I don't want to tell you it's not, and then you're not prepared. And I think it probably will get moved to June or July, because it's what go through.
Yeah, the statement of work 4 has a large group of other organizations that you potentially want to hear from, and you're already offering a longer meeting next month. So I just think we could have a little clarity on what the process might really end up being.
So I'll just say that it's a process of flux, right? What we tried to do is give 2 opportunities to fund in a year. And Colorado Health Foundation does this, and as you know, they just came up with their list of approved applications, and then 2 weeks later, you got to decide to apply again. They actually don't even let you apply for the following year doing some research. So if you're not awarded, you can't apply for the following year. We're doing something in between that says that you can be awarded in the cycle you can apply again in July, but it's starting to get pushed because of the amount of applications. So, all I have to say is that one thing we could do is move her organization up if you felt that would be effective, or we could, just keep going and with that growth, it might be pushed back.
Okay, yeah, that's all good, and I'm grateful that we can present next month. You know, our original contracts also had opportunities for just a renewal of the existing work. And we were encouraged to reapply and not even talk to the administrators about a renewal. So that's been a question out there that has never been addressed.
So I'll speak to that. So this renewal opportunity was kind of before my time. And part of the challenge we ran into is the data requirements and the data that we were getting back was hard to make sense of. So I don't think it felt helpful just saying, hey, look good based on data that it wasn't really vetting. There was no way to say apples to apples, and outcomes really an important focus here. So the suggestion wasn't bring it. I agree with you wholeheartedly. Let's bring it as we get the contract signed for the next group. It should be an easier way to hit the button. That when it gets back to the data that we asked for at the beginning, the data we get back, they can present it during the year, feel comfortable, and then it's just a free money. So given how it went out the first time, we weren't able to do it.
So Beth, I'm just trying to understand exactly what you're saying. So what you're saying basically is you got the first year of funding that expires on June 30th.
We're gonna spend it all by June 30th.
And then you don't know what's going to happen. So you don't know whether to hang on to people and fund them out of some contingency that will then you'll be able to cover when you get it.
Yeah.
Or whether you won't, and now you're just out contingency money, and then you have to let everybody up.
Is there a way to triage the period to make, because that's right, phone call? Are you at a critical timeline like she is, or can you be bumped a little bit?
I can call those calls, thank you. I did get a conversation with her and a couple other groups, and they are scheduled because of this. That's what I was going to allude to. They are scheduled to get into. The reality is, from they get that yes to the point of the funding coming, there's still a little bit of gap, but that's up to you.
As long as we know next month at the June meeting that we're down, then I can plan with 30 to 60 days of moving funds around. But if it's gonna be kicked to 90 days like that, then really has a big impact.
Sure. And I bet you somebody in that group can say, I can defer my time for a month so she can get it.
She's already in.
Well, I mean,
She's already in.
Correct.
Yeah.
She just needs to know what it's
just
covered.
make sure that people that are urgent like that are at the top, so we absolutely get to them first.
I agree.
I think that the question that I have though is, are we making a funding decision on the same day that they're presenting? Because we have all those other people, we're not going to be finished with all the 4 presentations, and the way that we have been doing them would not, in my mind, I would not be thinking of taking an actual vote. We have thumbs up and thumbs down, but that's not an approval, right? So are you comfortable with just that thumbs up? Or are you full moving?
I think I mean, I could work with a thumbs up. It's been interesting to watch today because none of you have said that a thumbs up means that organization's moving forward to contracting. I think that's what's implied in today's process.
It's the next step, but
Yeah.
Contracting the data, like I think to be clear, the thumbs up was provisional before to that stage. Yeah. So that.
But it's not a guarantee of funding, and I always want to make sure that we're all understanding. It's hey, we're not weeding these people out at this stage, but when we get down to the buckets and deciding what we want, it could. I just want to, because I think we want to be clear about what the different things actually mean, because it's not a done deal until there's a motion and there's an approval.
And this one is larger than the other groups, because at the point we're able to get through the prevention, get students feel comfortable. Yours is not done in one sitting, it's gonna be a couple of settings. This is a large part.
Okay. Thank you for additional conversation on it.
Thank you.
And then before we move forward, can you bring up another issue?
Mr. Chair, thanks for recalling this. Thank you all for giving me just a second to process. Jim's absolutely correct. Anytime we have more than 2 council members discussing public business, would need to post that under open meetings law. And a chance to confer with Becky for procurement. I think she would be more comfortable with it not being a public meeting of that group. I think that would require reconfiguring how it is, probably up to 2 council members and possibly staff. Or alternatively, we could post it, it would be basically that meeting would be posted on the county website, just like these are. And the public could attend and watch the evaluations go forward.
Again, sorry that you had to wait on that, we're already after hours.
So a thought with that is have one council member that would be on that special committee and then non-voting members that don't have any, say or will gain from that being on.
Well,
that
the presence though is what triggers the open meeting.
Yeah,
stuff,
the elected.
not whether you're voted or not.
Yeah.
On the outcome.
You're elected or not.
Okay.
I mean, personally, I'm in a Teller County mindset. We post stuff all the time.
Yeah.
Nobody ever shows up.
That's right, that's what it comes down to, is that it doesn't actually hurt to post it.
You post it, let us, if they don't wanna be here, but
Yeah.
or wherever it is. I mean, conference room somewhere. I mean,
It would be a Zoom meeting for the record. I was in meeting.
So typically, since this is an open solicitation, procurement rules are, it's confidential until award. So that was my only hesitation with Indian Covenant,
Well, does that change though, that this is opioid money, it's not county money?
but it's running with solicitation planning process and procedures. So I was just running it under the same rules.
Yeah, I think it would be, I mean, Kenny, I don't know if you thinking on the fly here, I don't know that it necessarily has to be that way, since it's opioid council, it's not county.
I think that a meeting of that subcommittee could be posted and available to be viewed by the public while the discussion is ongoing. The comments might be a little bit more maybe confidential.
There's a way to iron it out, but.
Well, can you have an executive session?
yeah, that was gonna be my question.
Potential negotiation of contract. That's right. That's exactly what it is.
I think so.
Yeah, executive session.
So I think we're one,
We'll take that one, figure it out.
I think it's okay to have the group being a full person who post the meetings and then just go to executive or something like that. For those portions of that discussion. Don't you think?
Absolutely, I think we could do that and I can just work with young others. Thank you, right? Okay, so that we have a plan for the next meeting. We have the COAC updates, it's really quick. The COAC update is that Amanda requested information from so COAC is the Colorado, they would be the council, we have the different regions, have an annual meeting, many of us went to it last year, they don't have that date scheduled yet. They have monthly meetings that we attend. I'll put the minutes from those monthly meetings into the items that come forward. But the biggest thing is they're getting all the data from the different councils. Amanda had a request to send something back by April. She did that. She can talk about it further over next. Amanda is not at this meeting, but she did ask me to hand out the that came in today to hand out the finance report. I'm going to take questions on the finance report. I'm going to hand it out. It's be at the next meeting and it's on the way to our here. Okay.
So one question, because of the huge number of applications we had in that one bucket, is going back to Carrie's comment about is there how well the rubric does in filtering these when you have so many of them. And just wondering if we should just provide access from the board to all of those.
So the only goal of this was to try to tie things. Like my chance, you want the circle and some of the others, but nothing's perfect. But the only goal here was this wasn't going to be a defining aspect. It was be a way to rank them, a way to score them, a way to interview them. But to your point, it seems like this group is more comfortable with maybe sticking with interviewing everybody, and that's a hard.
I'm not looking at everybody.
Okay.
But there's just so many of them that it's kind of hard to say, well, top 5 out of 24.
Yeah, there was a that section of 21.
Yeah, out of 21, it's like, it's a little bit arbitrary to say these are them. So I guess maybe we have homework to do.
Yeah, and
Although if we had confidence in the scoring to Carrie's point, that then we could potentially come up with a cutoff point, right? If you had confidence in the scoring, if you're that.
there'd be another subcommittee where, I might, we did the first pass, we got somebody that worked it
Yeah,
down.
well, and also the size of some of these requests, you have everything from $100,000 to 1.5 million.
Another thing that would make it easier next time, I think it was suggested one of the council members that we make sure that everybody's apples to apples, the application size. As you remember, some people wrote 2 pages, some people wrote 2 Ds, and that's where it can be a little bit complicated. But I have all the applications, I read them all, you all have access to all of them, I'll send them all out again, along with the shorter summaries. I was just trying to get more engagement by making it this way and having questions, and I feel like more people were engaged today, but complicated. So, you have the original applications, you can go to that, it's a lot.
Going forward, I think character limits would be good. And as far as writing a treatise, we did. And then also some guidelines around funding. Now, most organizations just don't leave it wide open. And so we had, we have a 1.5 million, well, that's 10, more than 10% of our entire.
Say more, you're saying in terms of funding,
Yeah, I think we should have a smaller, I think we should give more guidelines, because some organizations will have, whether it's, we kind of go by 25 to 30% of what your overall need is, or ones that say, 400,000 or less, or whatever, just something, so we don't have 50,000 to 1.5 million.
Actually disagree with that because there are some scopes that are just gonna be large and very impactful, and I would much rather leave it open. We don't have, we are all smart, intelligent people. We can weigh whether or not it's worthy of what we think it is, but I just think if you ask me what we are trying to achieve, it's effectiveness. And that's what I'm gonna weigh everything. And I don't know that I could say only $400,000 grants will be effective, or, and my idea isn't just sprinkle everywhere either. I think we wanna look at it's just very hard to tell until we know it comes in. So I don't mind the differences as long as we all get to, come to the table and have a discussion about whether it's worthwhile at the end of the day.
so, any comments? Okay, so with that, I'll have one about public comments. Please come to the front and the green here, state your name, your organization you're with.
Eric Olson, I'm Director of Colorado Strategy with Face It Together. We're in the same exact boat as Homeward Pike Peak. We applied for 12 months. And it's an 18-month contract. So we actually want to amend our ask of 240,000 to 88,500 just to get through the Q3 and Q4 of this year. Because we will lapse on our coverage, or our services that we offer to not only El Paso, but Teller County as well. Come the end of June, we will be out of funding. So just want to kind of stress that if there is a way to make a decision next meeting, I'm not sure if that's exactly possible, but just want to stress that.
Appreciate it. Thank you. Other public comments? Any other public comments? I'm sorry. Sherry also has been communication and the same topic of funding.
Yeah, Sherry Trader, just running the Recovery Connection again. We have the June deadline as well. And from the funding perspective, I am comfortable with making reductions in force if I need to, but if I don't have to, and we're doing the work that we're supposed to be doing, I'd like to figure out a way to make sure we're breathing good. So thank you.
Thank you. She's presenting for the next meeting as well. So many of the groups I've heard about, they are presenting at the next meeting. There might be others, so good advice. I'm going to survey and see if there's any others who just have live conversations and others, and see if so, I'll ask one of the groups if they are in the similar funding. The real issue is those who previously funded and the inability to just reallocate them and take them out of the broader bucket funding. But it was not figured out.
I just thought though, maybe I'm just taking two things I remember and combining them into one. I thought we had taken all of those and those were to go to the end of fiscal year 2025. All of those previous ones that we funded.
So Amanda's not here, but I thought what they did was we moved 12 to 18 months. That might be a question.
That was what I was thinking.
Yeah. That's the question. I know there was time and the state got involved, that the way the funding was coming down. It's a complicated kind of question. Yeah.
Okay. So
So, fun topic is LART. With the city, they doled out much money every single year, and they found out that there's actually 4 agencies that really do a lot towards tourism and probably should just have a contract And so possibly we might look at some point, because like the one group that was 78% of what asked was for personnel. Well, what if we're late next year? Well, we reward them, we're late next year, they're gonna have to lay off all those people, and they'll be standing right there saying, hey. Right? So possibly we might look at a group that we want to say we want to provide sustainable funding for. And that their contract could change over time or something like, you see what I'm trying to do? Is maybe eliminate a few groups just because we give them a sustainable funding piece because they're doing the right work.
Every group, I mean, there's a lot of creative things that are happening. So, I think people are saying, oh, not money's coming out quickly, but a lot of groups are very reticent to push money out for duplication or the wrong things. So a group, I can't remember the Pioneer Region one, but it includes Idaho Springs and Fair Creek County up north. It's led by a physician and a facilitator. And they are very discriminate and they have the same concerns. So wait a minute, how do we know it's not going here? So they've been slow to push out money. That's the intent behind the other group that's saying, I want a letter of intent first. We want to make sure this even makes sense. So as we move towards the July deadline, a couple of things. One, have an opportunity to reassess the process and see if you want a different application process. Two, we might want to say, instead of talking about accepting more applications in July, maybe we move back further with new guardrails. So to Dave's point, I think there's things we can do for the July session that makes our work a lot more meaningful. Line. Let's not forget as well, the dashboard, we've got to know with the dashboard, we have to work, show it to you to get through a lot. That dashboard can drive a lot of decisions. That's what it for the actionable data. But in order to do that, we get good data in, put good data out. That's what we are on the background.
What we've really worked towards with these contracts is really trying to ask them clear KPIs on how are they affecting tourism. Because their contracts are going to be up in 2 years and they're going to get reevaluated at that time. So, but the point was, is we were able to tell them, hey, you have a 5-year, you're going to give a 5-year contract. Now they're not on the list anymore. You know what I'm saying? So could be some groups like that we might.
Yeah, I think the challenge for us is how do we make sure that we're being effectively using our money? And if we just put them on a 5-year contract, we're not gonna have any way oversight over.
Well, that's the KPI reporting.
Yeah. But we don't have any measurements like that either. Yeah, so. I like the idea, but I think those are the things we gotta figure out.
Yeah.
Not to belabor the subject, but I think there's also, if Amanda weren't here, I don't wanna speak for Amanda, but there's a difference between contracts and grants. We kind of go around and around a little bit, and that is one of the things that I think we can continue to get down the road on, but to my point, we don't have those specific measurements, so Lark's been around a lot longer than the opioid council, maybe we can get there, I hope that we can get there. But I also think there are a lot of organizations that we don't know about, we wanna be careful that we don't spend our whole bucket of money on came in the janitors too.
And that's contract of services, it's back to why we have a different process now in the city with that high opioid concentration. That is that, so different set of processes. Okay, we're at the end of public comments and they're no longer leaving. Any final comments, questions, or anything you're sure?
So just real quickly, so we've got Mindy's up here to help us close out our chair, and then we've got our investigator downstairs to teach you out the authority because it doesn't just automatically open, so that piece that will have to be something you and I will need to talk about too when we go past 5 DAO employees that are actually sitting around working past the working hours to accommodate this group. So when you see our 2 employees, please stand at the door, stick around.
Most students.
Second.